So with me today, let me introduce myself. First and foremost, my name is Olufadeke Omo Moradian, and with me is
Margaret Owutu.
a round of applause for us. We're not encouraged. You can do better. Thank you. We need all the energy we can get in the room. So before we go into the event proper, we would like you to meet someone. That is, meet the person close to you, not necessarily the person you came with today. So I'll be asking you if you've met someone new. So this is time for meet and greet. Please stand up, meet someone, say hello, welcome, what's your name? So this is the time where the gentlemen hanging at the back will come to the front. Please meet someone, meet someone, meet someone.
Networking opens doors, please. There's no room for shyness here. Tell someone your name and what you do. You never know. The next plug you're looking for might be in this room.
You know, some people don't slack at all. They're already taking it fully. Aha. Thank you very much. So let's get back to our set. I'm super grateful to God for the fine weather. This is the fine weather in the Lagos of today. There's no rain. I'm a September baby, so I know that every day in September there's a chance that, thank you, there's a chance that rain, can fall. So, Oyinko, you're very lucky. It's a wonderful day. It's a bright day. So, going into the program, we would like to appreciate some of the sponsors that we have, okay? We have Nordic Hotel Lagos. Please, let's appreciate them. The Rotary Club of Aja. Arise TV. Eta Memorial Hospital, Lekki. Total Energies Nigeria. Not the least, Endo Survivors International. And then we want to encourage everyone here by clapping for ourselves because you are also part of the support system. Thank you for being here. Thank you. Over to you, Margaret.
So once again, we would like to say thank you so much for taking our time to attend here. So we're going to start briefly with the introduction and the welcome address by the lovely founder, Mrs. Oyinko Ostisoya. She will be speaking about empowering women for healthy lives and unlocking the power of gynecological health. So before she comes up, I'd just like to tell you about her and a little bit about her journey, and she'll come and tell you the rest herself. So Oyinko is the founder of My Gynae Issues Foundation. She's a women's health advocate, a 3-time fibroid survivor, and actively involved in women's health care, patients' rights, and advocacy. She is passionate about helping women who suffer from reproductive health conditions. After a 3rd open myectomy surgery, she was also able to get rid of multiple uterine fibroids in November 2018. Fibroids, as we all know, are common. They are non-cancerous tumor growths in the womb, and they have the potential of causing a myriad of problems, from heavy periods, pelvic pain, and sometimes infertility. Oyinko easily opens discussions on this topical medical issue, providing patients a view and exploring the symptoms, causes, treatments, and whilst also advocating support for these women. Please, can we give a round of applause for her? Having celebrated her 6th anniversary, soon to be 7th year of being fibroid-free, she is keen to ensure that more women become free like her from any gynae-related condition that they may have. Her personal experience with fibroids has fueled her passion to start the My Gynae Issues Foundation in July 2020. And this foundation serves as a support system and an advocacy group for fibroid sufferers and a much-needed community, which is very important for patients with these conditions. So when Oyinko is not talking gynae matters, she's a wonderful colleague. She's the head of administration at the Chapel Hill Denham organization, which is Nigeria's premier investment bank. Please, a round of applause for us. Oyinko holds a master's in creative digital media from the London South Bank University, United Kingdom, and a higher national diploma in mass communications from Ogun State Polytechnic at Belkota. Without much further ado, may we welcome the wonderful Lady O, Oyinko Oshisoya.
Wow, amazing. Thank you all so much for being here. Thank you. Good morning, ladies and gentlemen, esteemed guests, distinguished speakers, and fellow advocates for women's health. I welcome you all very warmly. I'm honored actually to welcome you to the Gynaecological Health Summit 2024. This is phase 1. Okay? We thank you for coming, and we appreciate the fact that you're taking time out, of your very busy schedule to be in attendance today. Today we gather here to address official issues, right? We want to share expertise and advance the well-being of women everywhere. Okay? Our mission is simple yet profound, right? It is empowering women through education, awareness, advocacy. Okay, this summit represents a crucial step forward in our collective pursuit of excellence in gynecological health. We extend our deepest gratitude to all the organizations mentioned earlier so that I'm not repeating them again. We want to acknowledge all the representatives who are here, and I want to say that your commitment to women's health is inspiring, and we appreciate your trust in our mission. Thank you all so much. To our speakers, our keynote speaker, Professor Rotimi Jaisimi, and our special guests, Ms. Pearl Alaire, and panelists, I want to thank you for sharing your valuable insights and your expertise and experience. Thank you all so much for coming. Welcome. I hope you have a very wonderful time here.
I think he's joining us from the UK, so they're going to roll down the screen. And he'll be speaking on gynecological health, what every woman must know. So he'll be taking us through a comprehensive overview of gynecological health, and of course, what the risk issues are, risk factors, and prevention strategies. So media, are we ready for talk? Good morning, Prof. Can you hear me?
Good morning. Can you hear me?
Yes, we can, sir. Can you hear us?
Yes, I can hear you loud and clear, and I can see you as well.
You're welcome, sir.
I think first and foremost is to say good morning. I believe we're all in the same time zone, or most of us, and apologies that I cannot be with you in person. At the moment, I'm in the United Kingdom. So I just want to say thank you to the organizers, the Chief Executive Officer of my gynae issues, Ms. Oyinko Oshisoya, popularly known as Lady O, for this kind invitation. And also to those who we describe as my gynae warriors. They know who they are, and they have been very supportive in what's been going on. Now, the keynote address is based on gynecological health, what every woman should know. Gynecological health is not only crucial for individuals, but also for the overall health of our own community and society. And when I was told or asked whether I'll speak about this, I questioned it whether I was the best person or whether I was best placed to speak on the topic. Because first and foremost, I am a man, and women have periods throughout their life, maybe about 7 years of their life, women have periods. And I haven't even had one. So what experience have I got to talk about gynecological problems and what women should know? But having said that, I mean, I was born by a woman. I was raised by a woman. I am married to a woman. I have daughters. And guess what? I look after women as a gynecologist. So I do have some insight into the problems that women face. So today I aim to throw light upon the essential aspects of gynecological health that every woman should be aware of, empowering them with knowledge that can lead to better health outcomes. Well, you might say, what is health? The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not just the absence of disease or infirmity. So this definition emphasizes that health encompasses a holistic view of well-being, and that includes physical, emotional, social dimensions to individual lives, rather than just simply focusing on the absence of illness. So what does it mean when we talk about gynecological health? Gynecological health encompasses a wide range of issues related to the female reproductive system. I will try not to use a lot of medical jargon, but where I do, explain what it means. So the female reproductive system includes the vagina, the uterus, which is the womb, the ovaries, the fallopian tubes, and the breast. So it's very important to understand this system as it plays an overall role, a critical role in the health of women, in hormonal issues, hormones produced by the ovaries, and reproductive capability. So when we talk about gynecological health, we might question, why is it important? Why should we talk? Because gynecology has to do with female medical disorders. And I will start by saying cancer is one of them, and I will not go into details of every one of them, but just to give a picture of the problem that women face. When you look at breast cancer, and let me qualify this, in some countries, breast issues are dealt with by breast surgeons. In years gone, gynecologists address some of these issues when it comes to the breast, and in some countries they still do. But I won't, because it's a gynae problem, it's a female problem, I have included breast cancer in this. It's a major health problem in Nigeria, and it's the most common cancer among women, with an estimated 140,000 cases being diagnosed annually. And approximately over almost 12,000 women die from breast cancer every year in Nigeria. And I say that word again, or that figure again. Over 12,000 women die from breast cancer. And this shouldn't be the case. The high incidence and the mortality are often attributed to factors as patients, women not presenting early to doctors, then the lack of infrastructure for screening and then for treatment, and then the limited awareness of the disease. And this is where organizations and foundations or NGOs or CSOs such as Gynaecology issues come into the picture in terms of raising awareness, in terms of being a voice for women. Now, the other cancer that I want to mention briefly is cervical cancer. It's a significant health issue in Nigeria. It's the second most common cancer, and it occurs between the ages of 15 and 44. Around 12,000 women are diagnosed with cervical cancer every year in Nigeria. And sadly, about 8,000 women die from cervical cancer. Again, one of the sad things about that is that cervical cancer is preventable. So if it's a preventable cancer, and it's one of the very few preventable cancers, then why do we have 8,000 women dying in Nigeria annually? We will address that as we go on in this address that I'm giving. I'm moving over to what I describe as benign gynecological problems. I started off with cancer, and I will go into uterine fibroids, which is one of the commonest gynecological problems that women in Nigeria, in Africa, and even globally face. Now, it's common in Nigeria. It's a growth in the womb, common between the ages of 30 and 39, but you could have it younger or even later in life, and they can cause a lot of problems to women. That's a lot of morbidity. Even though they are simple growths within the womb, they can cause many things like heavy periods, anemia, lethargy, infertility, difficulty getting pregnant, and a lot of these do have its impact on the quality of life of people. So it's important that we have that into perspective. One of the things I have decided today is not a lecture, it's not a scientific lecture, it's a keynote address to draw our attention, the attention of the public, the attention of policymakers to the problems that women face in our society. Pelvic pain, chronic pelvic pain. I think pain is pain, and pain is not a good thing. And there are a number of gynecological conditions that can result in pelvic pain that affect women. Even menstruation. Menstruation, people have dysmenorrhea, and at times it depends on people's menstruation. But the dysmenorrhea, the pain due to menstruation, for some people can be very debilitating. So that's one of the issues that can cause pelvic pain. And you have women who, during their periods, because of the pain or because of the heaviness of the bleeding, are not able to go out, and as such, they don't go to work, they're home until the pain subsides, until they finish their periods. We'll discuss about that later. Endometriosis is another benign, and when I say benign, non-cancerous simple condition. Simple, not to say it with levity. When I use the word simple condition, I just mean it's not cancer. But these are conditions that do affect women's lives. So endometriosis is another condition where you have the tissue lining the womb, the endometrium, growing outside of the womb. And it can cause severe pain, it can cause infertility, that is the inability to fall pregnant, amongst other things. Similar to endometriosis is another condition called adenomyosis. So rather than the lining of the womb, that kind of tissue being outside of the womb, it is within the muscle of the womb, and that's called adenomyosis. Again, that can cause heavy periods, painful periods, and again, it's not a pleasant thing to have. And other conditions such as having had multiple sexual transmitted infections over the years resulting in scar tissue can cause pelvic pain, chronic pelvic pain. So that is talking about cancer and benign conditions. But one of the commonest things, and when I say the commonest thing, It's not even the commonest thing. It is a known fact. It's something we cannot do. They're beginning to be what you can call a lady, that their fertility is becoming established. But menstruation, having a period every month, can be associated with issues. Now, like I said, it can start from as young as 8, and it can go on till the age of 55. So you can imagine having periods bleeding for 5 to 7 days every month from the age of 8 to the age of 55, maximum 55. That is a long time. And like I said, the cycle varies from 21 to 35 days. People bleed for about 5 to 7 days. And again, this is associated with discomfort, with pain. People have to take painkillers, paracetamol, Panadol, hot water bottle. One of the other things people take, and I want to mention it specifically, are things like Brufen, ibuprofen, naproxen, and stuff like that. One of the things that we don't often tell our patients is that Brufen, naproxen, and drugs in that group have a negative effect on our kidneys. So we should be cautious when we take all those non-steroidal anti-inflammatory drugs, because they can damage the kidneys. Again, one of the good things as technology comes into practice is that women are now able to track using apps on their telephone, their menstrual cycle. They know when it's coming, when to expect it, and they can prepare for it. More so if your cycle is regular. I think years gone, many, many years ago, as a trainee doctor, and I think maybe perhaps education wasn't as good as it is now. When we did ask women when their last menstrual period was, you have some of them who will say, oh, I have to ask my husband, that kind of stuff, or they don't know. It has to, at times it has to do with literacy, but I think things are changing, awareness, education, and then, like I've just said, people have mobile phone, you can download an app that will track your menstrual cycle. And when you know when your periods are likely to come, then you can prepare for it. When you go out, you can take your sanitary wears, protective wears, so that you don't get accidents. Now decide they want to have a family, because they are not ovulating every month, then it can be difficult to fall pregnant unless you have medical intervention. So one of the things that I would say is most of us, or some of us, we have our cars, we take it to the garage, we go that extra mile to look after the cars, we check the engine oil, we check the tire pressures before we set out on the journey. And I ask myself, if I can do that to my car, then why can't I look after my body? Why can't I check that the whole body system, the different systems are or is in good shape? And this is where health screening in gynecology comes into the picture. That women need to avail themselves of screening programs that are available. Prevention is better than cure, or if you pick up disease processes early, then you can treat them, and when you treat them, then the outcome is better. Before I forget, and I think at this stage, I should mention, because I may not mention it later on, the diagnosis of endometriosis. Pelvic pain. When women, young women, I think if the pain is severe and persistent and occurring every month and affecting the quality of life, I will appeal to my colleagues, and I'm sure they all know this, that we should think endometriosis. Endometriosis is probably under
What exactly are you looking for? Anybody knows what she's looking for? Anybody?
Presenting early.
Okay.
So instead of staying back, if you anything you just notice, go to the doctor early, present early, so that they can nip whatever it is in the bud on time. Do I get a prize?
Let me think about it.
Okay, clap will do. A clap will do.
A clap.
Thank you. Okay. Another question, or should we do?
Please go on. Please go on.
Okay. Let's see.
I'm enjoying the session.
Of-
Your session.
Okay. So of all of the cancers that he mentioned, which one is preventable? Correct.
A round of applause for them.
Okay. Maybe what I should do is tell them a bit more about Prof.
Okay.
Ayodele Kayode Gynaecology. So he is currently the Associate Medical Doctor for Patient Safety at Basildon University Hospital in Essex and visiting professor at the Faculty of Law, University of Ibadan. Ibadan usually gets the good doctors. He is a UK National Health Service Patient Safety Specialist. He is a Senior Fellow of the Faculty of Medical Leadership and Management and a Fellow of the Institute of Information Management, a Fellow of the West African College of Surgeons and Fellow, Royal College of Obstetricians and Gynecologists. He also holds a master's degree in business administration from the Newcastle Business School and a master's degree in medical law from Northumbria University in Newcastle. Professor Gynaecology is a transformation agent with a vast wealth of experience in clinical care, health policy, and global health development. He co-authored Nigeria's national policy on gender and health and contributed to Nigeria's national policy on diaspora matters. He has published over 60 scientific articles and presented at numerous international scientific conferences. He is currently the chairman of the advisory board.
And it doesn't give me that opportunity.
Okay, you're back online.
You're back,
Yeah.
sir.
Thank you. You're back online.
So where did I get up to?
Prof, can you hear me?
Where did I get up to?
Yes, you were
About 5 minutes. We lost you for about 5 minutes now.
About 5 minutes. Okay, let's see. Okay, I think what I will do, just to summarize what I was saying, I think what I've been trying to say in the last 5 minutes was that Nigeria has introduced the human papilloma vaccines for girls aged between 9 and 14. And we know that the vaccine is very effective in preventing women going on to develop cervical cancer that kills about 8,000 women in Nigeria every year. So we are advocating that as parents, we should allow our young children, girls, to have the vaccine. And like I said, over 12 million Nigerian girls have had the vaccines, and we haven't had any issue. I have tried to talk about the myth about vaccines that, oh, it's the ploy of the Western world. They want to reduce our population, they want to kill us, and it's going to affect fertility and stuff like that. That is not correct. And again, I went on to say that in some countries, the human papilloma virus vaccine is also given to boys between the ages of 9 and 14, because this virus is also present in the genitals and the semen of boys, and it's a sexually transmitted infection. So if we're able to protect the girls and protect the boys, in years to come, cervical cancer will be very, very, it will be a burden, a gynecological problem. I think that is where I was. Can you still hear me?
Loud and clear.
Hello?
We can hear you, Prof.
Yes, we can, Prof.
Right, please,
Yes, we can.
if you can, please just let me know so that I don't just go on. I did receive a phone call, so I knew there was something the matter. So if there's any technical problem, please just let me know. So I will continue. Now, when we talk about gynecological health, well, if you don't know your body, then how would you know when things are going wrong? So it's important, as parents, when I was growing up, we never spoke about sexual issues. Our parents didn't speak to us about sexual issues. They never even spoke to us about, when I say us, boys and girls, about menstruation. What they would tell you is that, oh, don't let a boy touch you when people get to, when they start having periods. And so when you say don't let a boy touch you, their understanding is just even a physical touch, putting my hands on your shoulder or on your back, that you'll fall pregnant. I think in 2024, things have changed, and sexual health and sexual health education is important. So one cannot overemphasize that women need to know their body. And the only way women will know their body is when we as parents engage with our children and talk openly to them about the changes they're going through when they get to puberty, the hygiene when it comes to menstruation, then having to protect themselves when they become sexually active, because sexually transmitted infection is also a large burden of gynecological problem. So it is important that we do that. And when I speak about sexual health and sexually transmitted infection, there's a lot going on in society globally. We are now in a liberal society where people now start sex, having intimacy from a young age. And even again, regrettably, there are people who have multiple partners. Now, as parents, as guardians, there's no way you will know. It's not written on the forehead. And what you should do is, as part of the health education, is look, if you are going to engage in it, protect yourself. And that is where the use of condoms is very important. If they don't, then they are at risk of contracting chlamydia, gonorrhea, and other sexually transmitted infections. And this can damage the fallopian tubes that could make having children difficult or even impossible in years down the line. So safe sexual practices is important as a gynecological issue. Now, the other thing is unwanted pregnancy. I mean, I know in the audience there are Christians, there are Muslims, there are unbelievers, and there are religious teachings about some of these things. But in spite of religious teachings, we do know, and we have to be honest with ourselves, that these things do happen. So if we say, oh, I'm a Christian man, I'm pious, and I don't do it, like I said, not everybody tells what they do. And at times, as Fela said, you don't know what goes on behind closed doors. So the thing is, prevent yourself if you get into that kind of situation. Unprotected intercourse is not advisable. Multiple sexual partners, again, is not advisable. So do protect yourself. And when it comes to unwanted pregnancies, if you are, as a lady, sexually active, then make sure that if you are not ready for a baby or to have a pregnancy, then you must use some form of contraception. Yes, condoms are good, but they can fail, they can break, they can burst. And if it happens, you've got the after morning pill that you can get. And I'm not too certain whether it's, or you can get it over the counter in Nigeria, but in some countries you can walk into the pharmacy and ask for the morning after pill. I think you can get it in Nigeria. So women, again, we need to protect the rights of women. We have a society where it's patriarchal, where men are the head and men dictate some things, what women can do and what they cannot do. Now, when it comes to reproduction, that body belongs to the woman. It's not a man's body. And I think we need to give women that freedom to make choices in terms of contraception, in terms of making it available for them, so that they don't get into these difficulties of infections and fertility and pelvic pain because of what I've highlighted before. And when I speak about using protection, if you don't use protection and you fall pregnant and you're not married and you are not prepared for a baby, people turn to having abortions. Abortion is not legal in Nigeria. Abortion, I will say it again, is not legal in Nigeria, but we know that it takes place. And again, these are areas that the church, the state will discuss in future policy development, advocacy groups. What we don't want to happen, what we know happen at times is when women fall pregnant, because it's not legal, or if they go to an established institution, it's expensive, then they go to the back street people to procure abortion. And then that's where you get the complications, uterine perforation, infection, sepsis, and women can die from this complication. So it is important that I cannot overemphasize it. If you are not ready for a baby, please protect yourself. This message needs to go out from ourselves, we as parents, advocacy groups, that it's important that women have the right to choose what they do to their body and make contraception available for them. Or else, we'll be spending a lot of money treating the complications that in the first instance we could have prevented. One area I want to talk about, which again is a very great area, is the role of health, lifestyle, nutrition and lifestyle on gynecological health. And I say it's a great area because it's not common knowledge, it's not commonly accepted that you can take XYZ diet and it's going to prevent you from getting fibroids and stuff like that. But increasingly, we are getting to know that our lifestyle and the nutrition plays a big part in our health, including gynecological health. And when it comes to nutrition, diets that are rich in fruits, vegetables, healthy fats can help women maintain a healthy hormonal balance and reduce the risk of certain conditions. People say you should take omega-3 fatty acids, such as fish, flax seeds, if we have it in Nigeria, walnuts, that can help reduce inflammation and support the hormonal system. I think one of the things why we still don't know about this is it's not been subjected to research, or at times when the evidence is there. Don't forget that the pharmaceutical industry has a product to sell. And if there's a cheaper preventive measure, intervention that women can undertake, we are human and we know what goes on. There will be that attempt to suppress it, to discredit it. But I think even the medication we use, even the medication the pharmacy industry produces, they come from plants. So that's what I'll say. Your diet is good, very important. Exercise has been shown to reduce issues. If you exercise, you're not going to be overweight. If you're overweight, obesity, we know the fats can be converted to estrogen, and the estrogen feed fibroids to grow. Again, these are things that we haven't really undertaken a lot of research, but we do know that undertaking exercise does help. And apart from the weight management issue, it takes off stress. It helps you, gives you that buzz of mindfulness, wellness. Your mental health is better when you undertake exercise and when you sleep well. So it is very important that we do that. So I have spoken about this. I have, to a certain extent, mentioned issues about prevention is better than cure. So when people have heavy periods, I think you should seek help. If you have pain that is very severe, affecting your quality of life, you should seek doctor's advice. If you have any unusual vaginal discharge, whether it's the color, whether it's the odor, fishy smell, or whether you've got a breast lump or changes in the breast, please seek medical advice. When these things happen, it doesn't mean it's bad news or something that cannot be managed. One of the good phrases I hear in my gynae issues is having fibroids is not a death sentence. Because I think in Nigeria now, people think, oh, you've got fibroids. Oh, if you go for surgery, you're going to die. So these early symptoms, they're not. They don't mean you've got anything that's going to kill you. The only thing is, if you have it and you don't address it, then down the line, it might become sinister, become cancerous, because we don't know what it is. Talking about gynecology health, one area that we haven't really delved into is women who get to the age of 55 and stop having periods. That is the menopause, let's say. Menopausal or postmenopausal health is not something that we're giving great attention to, and it could be twofold. The reason could be twofold. Maybe up until recently, the lifespan of Nigerians was in the 50s. People died in mid-50s, before they are 60, they die. So they don't live in the postmenopausal phase for a long time. But the menopause has its own gynecological issues that can affect the quality of life. When you have hot flushes, night sweats, your bed linen is soaked with sweat, you've got to open the window because you're feeling warm. These are issues that can affect the quality of life. Alongside that is the mood issues that come with the menopause, sleep disturbances. People cannot sleep well, maybe because they are sweating. And so it's important that, again, we don't lose sight of the fact that women in the older age also have gynecological problems that they need to know about so that they can address it. There's hormone replacement therapy that can be given, can be used for a short time, 2 to 3 years, depending on the individual. If you want to use it for longer, and while you do your breast examination, then you can use it. The quality of life is important. So again, we mentioned diet, exercise is good for the postmenopausal phase of a woman's life. So regular exercise, a balanced diet, and stress management issues cannot be overemphasized. Now, having said all of this, why aren't we, as a nation, addressing this issue? We talk about it, but again, we haven't knocked it up. I know when we talk about maternal mortality, Nigeria has perhaps the highest now, if not India. If it's not India, it's Nigeria, of women dying from pregnancy-related issues. And some of these are down to abortions that's gone wrong, termination of pregnancy that's gone wrong. So and we haven't, as a nation, looked at the economic problems and social burden that gynecological health can impose or create on our society. Women, I mean, you bring us up. So if you're not in good health, you can't look after them. One is not the days where they say the woman's place is in the home. No. Women now occupy chief executive, C-suite, executive board level, they attend that. But if your gynecological health is not good, again, it's because she's a woman. Oh, we don't want to employ her because she's going to be falling pregnant. You know, all sorts of things. So there's an economic burden that if we don't attend to gynecological health, if women don't know their body and know how to manage it and know where to seek help for, it has an effect on the social and economic status of the nation. There are indirect costs. You have to go to health facilities. You have to buy drugs. A lot of things. You don't go to work. Absenteeism from work creates a lot of economic problems for the nation. But like I said, if these things are addressed, if you know your body as a woman and you seek help early, if it's heavy periods, just due to heavy periods, and when I say just due to heavy periods, there are no fibroids, there's no endometriosis, there's no adenomyosis. You can be given medication that will reduce the amount of pain and reduce the amount of blood loss, that will allow you to be able to have a good quality of life. If it's what I've said, due to endometriosis or fibroids, again, early intervention can help you at least live a near normal life and go to work. So again, I don't know whether we've heard about period poverty. Period poverty, like I said, women bleed for 7 years of their lifetime. Can you imagine how much women spend on buying sanitary wear? It's a lot. And in a country where at the moment there's a lot of economic, financial hardship, how much money do you have to spend every month buying tampons or sanitary wear? More so if your periods are such that they are heavy, it's soaked, and that is where people are now talking about period poverty. And it's even happening in Western nations. And what has happened in the UK is women have stood up and said, look, this is a normal thing. Government has to stand up and make sanitary wear free for women. So you go into some toilets, public toilets now, and there are dispensers where women can get sanitary wear. I think Nigeria or Africa should be looking at issues such as this. Being a woman is not a curse, and all the cultural taboos, stigma, we should do away with it. All the myths about fibroids being a curse or it's something you've done, I think we should educate ourselves. I'm pleased that we are speaking on a Saturday morning about issues such as this. Because unless we educate ourselves, and even unless we educate ourselves, not just as lay people, public people who use services, but also educate those who look after us, doctors, nurses, midwives, because continuous education is very important. And we've seen doctors who will tell you different things. We've seen doctors who are not well trained, but who in Nigeria look after women, and then things go wrong and damage the health of women. These are things that we're saying, know your health. You've got to choose your doctors. The doctors you go to, you've got to make sure they are well trained. The hospital facility you're going to, you've got to make sure they've got the right equipment, that they undertake quality assurance. And you might say, but how would I know that? It's through group advocacy groups. And that takes me to advocacy, or addressing the fears of women. When things happen, it's not, I mean, there's a lot of misinformation out there. I've said things like people say vaccines is to make us infertile. I mean, when the COVID vaccine came out, women, I mean, you get, if you fall pregnant, you will carry that pregnancy for 9 months. Even before it was 2 months of the vaccine, people were saying, oh, it causes infertility. I mean, you're not pregnant yet. So how can you say a new vaccine that has just come into the market causes infertility? People are said to be infertile if you've been trying to have a baby for 1 year of having regular sexual activity. So there's a lot of misinformation going out there. And people talk about, it's my village people. No, I mean, if you think it's your village people, then you won't go to the right places. And I must say, we've got to talk about these things in faith-based places, because again, they at times discourage women from accessing health care. It says faith without works is, I've forgotten what it complete, but you understand what I'm saying. The two go hand in hand. Nobody is saying you shouldn't believe in what your faith teaches, but again, our faith tells us that we should take action. And if God, Allah, did not want us to know, have the knowledge we as scientists have, we wouldn't have the knowledge we have. So let us use the health facilities that is available. and not discourage women from seeking help when they have gynecological issues. People have fibroids and they say, oh, they want to cast out demons and it's all sorts of things. I think we've got to be mindful of such misinformation because it just delays the diagnosis. And when it delays the diagnosis, it makes life difficult for women. When I was thinking about this talk, I was trying to think, if it were men menstruating every month and carrying babies for 9 months and having to go through all these hormonal changes, would we not have perhaps invested more in trying to make sure we have an answer to this thing? I don't know. But again, the Sustainable Development Goals, SDG 3, talks about wellness, about health and wellness. So people are talking about it. So my call more so is about advocacy. And I must commend my many issues. In the short time of existence, at the beginning of this keynote address, I did not give any declaration of interest. It's not a conflict of interest. I'm chair of the foundation, my Gynae Issues Foundation, and I support the foundation through webinars, through second opinion, through advice. So advocacy is very important. Raising awareness through educational campaigns is important. I'm happy that I heard that Arise TV is one of the sponsors or supporters. Again, we need to get this message out about gynecological health so that people hear about it, whether it's in the form of jingles, whether it's in the form of using influencers, celebrities and stuff like that. It is important that we advocate for women's health, better women's health in Nigeria and in Africa. And again, yes, it's good to advocate, but where do you change it? And I always talk about the big P, the political, the policy. And when you're going to change policy, you've got to go from grassroots, get the community leaders, the religious leaders involved to talk to the people in the community. And also, yeah, it's been shown to work. I think Nigeria has eradicated polio through polio vaccination. There's no reason why we cannot eradicate cervical cancer through HPV vaccines. So the advocacy group is important. We should try and influence policies, talk to the politicians, make presentations to politicians. And when I say politicians, they're policymakers, and they're the ones who will change things. And I think in the current government and previous governments, there's a Ministry of Women's Affairs, if that's the right name. There is a Ministry for Women's Issues. We should be talking to them. We should be holding them to account. What are you doing? What are you doing about this? I'm not saying they're not doing anything, but like I said, Nigeria has introduced the HPV virus. And one must commend the new government and what it's doing and trying to address health issues, including gynecological problems. I don't want to go into politics. And then capacity building. Again, yeah, a number of us, a lot of us perhaps live in urban areas. But what about relatives who live in hard-to-reach areas? How do we get support to them? This is where telemedicine is coming into play. But again, I could go on and on about that. That's a different area. There are not enough doctors. Everybody, doctors and nurses, healthcare professionals. The Japa syndrome is there, where all our doctors and nurses are leaving Nigeria for greener pastures. Again, it's a whole system. You have to look at the whole system. Talking of gynae and what women should know. Yeah, you could know about your body, but if the infrastructure to address the issues are not there, if the human resources in terms of doctors and nurses are not there, then what do? Then you go to self-medication. Again, it can be harmful. So again, I would enjoin each and every one of us that let us take gynecological issues seriously. Let us take women's health seriously. I tell people that without women, there will be no human race because women bring children into life. Yeah, you may say, well, without men, then they can't get pregnant. But if there's no woman, then the man cannot do anything, and vice versa anyway. So it's important. And I will also just put in this little bit. Data is important to drive change. So as NGOs, as foundations, collect data so that when you're talking to the policymakers, again, you can show them the difference you made as a small organization. There's no reason why you cannot work collaboratively to address issues. Why do Africans or Black people have fibroids more than Caucasians? We don't know. Why can't we have researchers within our country trying to look at it? And unless we advocate and push and say, look, where's the research? Why are you doing research? Why is government or international donor agencies not putting money into gynecological issues such as fibroids? But this is where advocacy comes into it. So, in conclusion, what I would say is gynecology health is multifaceted aspect of women's health, and it requires attention, it requires educating, and it requires an open and honest dialogue. And as we empower women and each other with knowledge, we can foster a culture of health and well-being. And what I want to do is to encourage every woman here today, I can't see the audience, that today, let's take charge of our health. Let women take charge of their health by going for your checkups, educating yourself about your body, and seeking help. And seeking help can be talking to a friend. I've noticed this, I've had this, and again, one of the things I was going to say is when you hear patients' stories, what patients have gone through, they are really, really powerful. It brings home to you vividly the problems that women or men go through when they're ill. And when people hear it, then the policy makers and politicians think that, oh my God, we didn't know this was the problem or this is a problem. And then they stand up to address that thing. So let us advocate for gynecological health, not just for ourselves, but for the future generations coming, the future generations of women. I talked about the liberal attitude in life now. Years ago, it was no sex before marriage. I think very few people talk about that now. And I'm not saying we're not here to judge. We're non-judgmental organizations. We're non-judgmental people. And again, we keep on saying the body belongs to that individual. But again, we must educate people to say, if you do this to your body without taking protection, these are the precautions that can happen. So if you want to engage in high-risk activities, then protect yourself. I think I have spoken for about an hour, and so every woman's health journey is unique. And my story might be different from yours. My experience can be different from yours. But I think when we compare notes, as they say, two heads are better than one, then we are able to address some of these issues that affect women. I want to see a world where women don't have to suffer in pain, where women don't have to suffer alone, where the scientific world take women's health seriously and invest in women's health. So, ladies and gentlemen, I'm assuming there are men listening. I'm sure most people listening are ladies, but men, I'm sure, perhaps, I think I saw a man online. Uh, Thank you for listening, and I'll hand over to moderators.
Thank
Thank
you
you very much,
so
sir.
much, Professor Jayasimi.
Thank you very much, sir.
If he's the one you are clapping for.
But I can hear
Yes.
Oracle.
Okay. The anchor is speaking. A question is being asked at the
Sorry.
moment. So we're trying to find out how to communicate that with you, knowing that there's been a glitch in our communication with you.
Is the person on site?
Yes, but I'm communicating with you, but we're not in the same space at the moment.
Or you're not in the same space? All right.
Yes, sir.
Does the person want to put it in the chat?
Yes, absolutely. We're working on that, sir.
Prof, can you hear me?
Thank you, sir.
Oh, you're welcome.
Okay, so I was saying that there are so many superstitious beliefs. For me, I would just want to add to what he has said. You know, as women, we need to advocate for ourselves. We have so many young people coming behind us. We have people in the rural communities who is getting across to them. You can imagine what technology has offered us, being people in Lagos, being people in urban areas. What about people in the rural settings? Who is speaking to them? Who is helping them? I think that beyond just coming here today, for everything that we have learned, it's important for you to hold somebody's hand. You know, hold probably a young girl's hand.
I know Temi Lola is speaking. Temi is speaking, but I can't hear her.
Yeah, she's speaking, sir.
But I can't hear her.
Yes. For him. Okay. Okay, so while that is going on, I was talking about, you know, helping somebody. Also, we need to stop body shaming one another. People's bodies are different. I think that is something that we grew up doing, and we are not conscious of the side effects. These days, you know, when you even try to body shame somebody, the person is telling you right there and then, please, can you stop? And I think that that's a right step in the right direction. Also, I think for me, one of the things I do very well is home remedies. I Google home remedies a lot. He said something about pharmaceutical industries, how they need to sell their products. A lot of people, you know, once they have pain, the next thing they are doing is popping painkillers into their mouths. I don't do that. If it's a pain I can bear, I bear. But I also appreciate the fact that there are some pains that you cannot bear and you need help. So home remedies help a lot. He talked about walnuts. There are so many. If there's anything, the first thing you should do is Google home remedies. You know, there are simple things that you can do that will not harm your body that can help. And lastly, I also realized that yoga helps a lot when it comes to pain. Your body, yoga helps a lot. So we can download apps where you can find yoga exercises that will suit you, that will work for that part of your body. So Margaret, over to you. Do we have the questions now? Oh, she's still writing. Okay. So for the people that want something, right? So while you are gathering what you want to say. So the people that answered our questions, who are the people? Yes. Thank you very much.
Hello, sir. Can you hear me? Sorry, one second.
You stepped out.
Prof, can you hear me?
Yes, I can hear you.
And God said, let there be light. Okay. Well, once again, we just want to say thank you very much, sir, for that insightful presentation. We're about collecting questions that the ladies might have to you so that you can answer. But I think I'll start off the bat with my question. First of all, is there an age that's too late to get the cervical vaccine for women? Because you kept referencing young ladies. But is there an age limit to which we can get the vaccine?
There's no age limit. The reason why people are saying it should be given to 9 to 14, you want to give it to them before they are exposed to the virus. Are not as effective as if you have it. And again, health economics comes into this. Again, like I said, these things are expensive and you cannot give it to everybody. If you go for your HPV testing and you're HPV negative, and again, if you are in a single relationship, you don't have multiple partners, and you take protection, then there may be no need for it. But if you think, okay, I'm negative, which means I haven't got the virus, but I want to protect myself against the virus, you will not get it under the government scheme in most countries because it's costly. But you can go privately to see a gynecologist and say, oh, please, can I have the vaccine? And you will get it. So that's where the age, it's health economics. And what we're trying to do is to prevent it before people get sexually active and get the virus. But if you've been sexually active and you already have the virus, having the vaccine possibly wouldn't do as much good as it would have been in terms of building your own immunity. If you've got the virus already, it has started acting on the cervix, creating changes to the cervix, abnormal smears that require treatment, and if not treated, eventually years down the line people get it. So just to summarize, there's no age. There's no age cutoff. The only thing is, we want to give it to young people before they become sexually active, before they come in contact with the virus. That's why it's being limited to 9 to 14 globally.
Okay, thank you very much. The room. A lady is asking, at what stage should you begin to worry over fibroids?
That's the first thing. How do you know you've got fibroids? Maybe if you've had very heavy periods, then you've got to present to the doctor. You may have fibroids, or you may not even know you've got fibroids, but your tummy is getting bigger and bigger, and people are saying, oh, when is your baby due? Oh, are you pregnant? And that kind of thing. Then you may not even have been aware. Or at times, ladies will think, oh, my skirt doesn't fit me well, I'm putting on weight. No, think, and so it's when you have symptoms. You know, I said we do health checks. What I usually tell people is, when you have anything, any deviation from normal, then seek medical advice. So, too much of your periods were not normal before, but they are becoming heavier, you're becoming anemic and lethargic, then you should seek medical advice. Not worry. I understand when you use the word worry, but that's when you should seek medical advice. If you've got pelvic pain that's excruciating, you've tried paracetamol, you've tried the remedies, you've tried yoga, you've tried exercise, and it's not going away, then seek medical advice. And usually you'll probably get an ultrasound examination. A history will be taken to start with. And that directs doctors and nurses as to what next to do, what investigations to do. Whether you need swabs to make sure you haven't got a sexually transmitted infection. So any deviation from normal that's affecting the quality of your life, I would say seek attention. So for fibroids, it's heavy periods, it can be painful, large clots, you are anemic up to the point that you yourself know that you haven't got the energy because you're anemic. Then check your blood count, is very low, you're getting blood transfusion, you're being told to take iron, then that's when you should start working. Fertility comes down the line in terms of fibroids. If you've been trying for a baby and it doesn't happen and get scanned, depending on what they see on the scan, if it's the fibroids compressing the fallopian tube or the fibroids making the cavity of the womb, distorting the cavity of the womb, then again, I wouldn't say get worried. What I would say is seek a gynecological advice. Thank you.
Thank you, sir. Okay, we have another question. It says, in a situation whereby a lady's breast gets hard and heavy and increases in size as a sign of her period coming, and then after the period, the breast goes back to normal, does she need to seek medical attention?
No, not at all. That is normal because before the periods, you've got water retention. The breast gets bigger due to fluid, even vasculation, there's more blood flow, and that's what makes it heavier and painful. And once you have your periods, it's a hormonal issue. And again, like I said, these things happen every day. And just if it's just breast enlargement that goes after the periods goes, then you don't have to worry about that. When you have to worry is when you examine yourself and you feel a lump, or when there's a discharge from the nipple, or by the time you're getting skin changes, then it's not, it's showing advanced disease. Women are advised to stand in front of a mirror after your periods. Again, we say examine yourself after your periods. That's because we know that just before then the breasts are engorged, and even if there's a lump there, because of the enlargement, you may not feel the lump easily. So it's after you've had a period, when things settle down, that you should examine yourself. I'm talking just to reinforce that, to tell you that just to reinforce that engorgement is not an abnormality. Some women will tell you that their rings, like the wedding rings, are tighter around that time, or even they have knee problem because of fluid retention in the knees or in their fingers. So the breast enlargement, is not an abnormality, it's not a pathology, it's not a disease. It's just part of the hormonal changes that occur during the menstrual and ovarian cycle.
Okay, thank you, sir. Another question we have is, what type of multivitamins or drugs would you recommend for ladies to take for their period health? So prior, to their period coming, when they're on their period, and afterwards.
Multivitamins. So there's no difference between one and the other. If you look at it, there are daily recommended doses, and most multivites stick within the daily recommended doses. The advice I would give is, not everybody takes vitamins. Healthy diet is key. Like we said earlier on, most of the drugs we take come from nature, from plants. So if you are eating well, a balanced diet, then you will be okay. Yes, there are some things like zinc, selenium, all these trace elements that we're really not sure. Magnesium, where do you get magnesium from? What does it do to the body? And so if you want to take multivitamins, most of them are similar. So there's no, it's like talking about Pepsi Cola and Coca-Cola. You understand what I mean? So multivitamins are multivitamins. So I won't recommend one over the other.
Okay, sir, thank you so much. I think we have a question on Zoom. Fadeka, do you want to read it out?
Okay, I have had fibroid surgery twice. So what is your advice on that? And what to avoid to help people having recurring situations, please? Also, I noticed that my period is still a bit heavy since after the surgery, though no more pains or cramps. Is this normal?
Lovely. Thank you for that question. When doctors go into, the thing about fibroids, they come in various sizes, and they can be as small as the head of a pin, as small as a peanut. So when doctors go in to do fibroid surgery, myomectomy, they don't take every single fibroid out. One, because they may not see all of it. And secondly, if you take too many out, then you may be left with a damaged womb because it all becomes ragged and gone into the cavity. And so we try to take what we can take out such that we don't damage the womb. But like I said, the tiny ones that the eyes cannot see or that are too small to take out, nothing stops them from growing again. So when you say, what advice do you have on diet? Like you've just been told, if you go online, you will see things about maybe what you should eat and what you should not eat. I believe that dietary, there is some dietary, there might be some dietary component to it, because fibroids are fed by estrogens. If you get to the menopause and your estrogen level falls, the fibroid is no longer there. Again, fibroids are common in people who haven't really had children. So every month you're having your estrogen stimulation. And again, so if, for example, when talking about diet, if you're taking a diet that has a lot of estrogen in it, phytoestrogens, then perhaps, like I said, the research hasn't been done. And as a doctor, I have to be very careful in saying, oh, this is the diet you must eat, or this is the diet you must eat. Eat a balanced diet. The portions you eat are very important. being big in size. Some people are naturally big, that's fine. But wanting to think that being big in size equates to wealth and that kind of thing, or it improves your sexuality, people are now doing all sorts of BBL or something like that. Again, do you know what it's doing to your health? So I look at the question. I have had fibroid surgery twice. So what is your advice on diet and what to avoid to help people having a recurring situation, please? So on diet is eat a balanced, healthy diet. Again, you cannot prevent recurrence of fibroids. If there are tiny growths there, for as long as you are still in the reproductive age, it could grow back again. And again, these things do not grow suddenly and become big overnight. They are slow growing tumors. When I use the word tumors, benign growth. So it's not going to grow from the head, from a peanut size to the size of a tennis ball in 1 year. And then the second part is, I notice my period is still a bit heavy, but you gain from the surgery in that you no longer have the pains or cramps. But when you have surgery, it's to bring the heaviness. Let's assume, for want of example, maybe you were bleeding 10 cups of blood, and now you're bleeding 2 cups. There's been an improvement. So it's still heavy, but it's better than what it was before. You understand? And you don't want to stop your periods altogether. So again, this is where the amount of blood loss has reduced, and the use of tranexamic acid or mefenamic acid, if you have to, I think one of our moderators said, they don't just jump into taking medication. You try the herbal remedies, your yoga, exercise, your diet before that. So I hope that addresses your question.
Thank you so much, Prof. We'll just be taking our very last question for this session.
Thank you very much, sir. Okay, so my question is around the medical check that I do annually. So they usually say that you do your pap smear, you do your breast exam, your mammogram and the likes, and then you do your ECG scan and every other thing. They also advise MRI. So my own concern is around MRI. Would you recommend MRI? Because I hear that it's not so good to expose your body to ultraviolet, I don't know, radiation or something exactly. So I just want to, I want you to share more light on it. Thank you.
Lovely. Thank you for that question. Subject yourself to tests or investigations that are not necessary. You don't require an MRI if you have no issues. Having an MRI is not a screening tool. Like you have rightly said, it's got radiological properties that if you subject it, there are small doses, but if you're doing that every year, you don't know what effects it's going to have on you. So please, no, I would say no, you don't need MRIs. Again, this is where we said talk to people. Some of these centers that have set up laboratories, they are profit, they want to make profit. So they will, I see people have all sorts of, you go for a gynae scan, and then they're scanning your liver, they're scanning your pancreas, they're scanning your thyroid, and I'm thinking, all of this adds to the cost when they give you your bill. So again, it has to be tailored, even as a medical student. when they say, what investigation will you do? You have to tailor the investigations you're doing to the history and to what you think is going on wrong. So don't just ask for all the investigations. When the laboratories do that, one, it's because you're going to pay for it. It's not free. If it were free, they wouldn't be doing it. You understand? That's number one. And I think I've forgotten what the second thing was. I mean, don't subject yourself just to. Then, for example, some people do pap smear every year. In Britain, we don't do pap smear every year because the pickup rate of abnormalities doing it every year is very low. So it's done every 3 years. In America, in the UK, health is free. America, you have to pay for it. And if you have your money, you can, if you want to spend it having your pap smear every year, then you can do it. But where it's an insurance-based health system in America, I'm sure some insurance company will not pay for you to have pap smear every year. And then you don't have any palpitations, you don't have any symptoms, then you don't need an ECG. What you should be checking is your blood pressure, and you can do that at home. And if it's normal, then it's okay. It's a different story if you get breathless by the time you walk 5 minutes or you're going up the stairs in your house. I said if you notice any change in your body, you could go up your staircase without being breathless. Then suddenly you're becoming breathless. You think, oh, I can't go up the stairs without being breathless. I can't walk down the street without being. That's when to seek help. And then that's when the doctors will put in place the investigation strategy. Thank you.
Thank you so much, sir. I know I said that was the last question, but the very last question.
Fibroid is a result of vitamin D deficiency.
I think that's number one. Over 70% of people have fibroids. I'm not certain that all, especially in Africa where we have the sun that converts the precursors of vitamin D in our skin to vitamin D. So Africans in Africa are not deficient in vitamin D because of the sun. The answer is it's not fibroids causing vitamin D. It's not vitamin D deficiency causing fibroids. I'm not saying there wouldn't be some association about maybe the rate of growth and something like that, but where is the scientific evidence? If I had said yes to your question, then you're going to go out today and say, oh, Professor Gyson said vitamin D deficiency causes fibroids. There's no research that has been done to prove that. And again, up front, I have said, eat a healthy, balanced diet. So if we are eating a healthy, balanced diet, people still get fibroids. We've said it's due to estrogen stimulation. One of the things that we haven't mentioned is the collagen, is our own tissue as black people, different from the white people. You know keloids. When some people have ear piercings, they develop keloids, or they have keloids, or even when black people go for surgery, their scar doesn't heal like just a simple one. Some of them are lumpy keloids. Again, is there something to do with the black race collagen as against the white person's collagen? And that is the area that we should be looking at. And even recently, I was thinking, when we take out those fibroids, why don't we subject them to micro analysis compared to what the Caucasians have? And you understand where I'm coming from. We need research to be able to know why women develop fibroids. If we don't know the why, then we cannot prevent it. Years ago, you had malaria and you were treated by malaria, but now we're having vaccines against malaria. You understand? So research needs to be done into what causes, what's the real underlying of fibroids. So please, eat a balanced diet, take your multivitamins. We just spoke about multivitamins. If you want to, take your multivitamins. In your multivitamins, you have vitamin D. And when we're talking about multivitamins, if you go to the shops, there will be some that will tell you that this is for under 50s, wellness multivitamins, and this is for people over 70. And again, it's just the dose differences. As you get older, you need calcium, you need vitamin D for your bone strength. So just vitamin D deficiency on its own is not the cause of fibroids. I'm a strong believer in vitamin D. Increasingly, it's been shown that vitamin D deficiency can even predispose to cancer. And I tell you, and I don't mind sharing my experience. When a colleague of mine, I went for something different, paid somewhere, and he said, "Oh, let me check your vitamin D." And I almost laughed to say, "Oh, why would I be vitamin D deficient?" And my results came back as severely deficient in vitamin D. And it's possible because I live in the UK, there's not much sun, my skin is black, so even the little sun, my skin gets in the vitamin D. I don't think my deficiency was due to that. It's there's no sunshine in the UK. And like I've said, and I mean, the pharma industry they have a drug to sell. Vitamin D is very cheap. You can get it for pennies and cobbles. And so if it's the wonder drug that's not going to make them sell their own product, then they're going to tell you.
Thank you.
So that's what I would say. Let's eat a healthy diet. If you want to take vitamin supplements, please do. It doesn't do you any harm for as long as you don't overdose. So that's important. If you take too much vitamin A, it has its own medical problems that it can cause. So don't overdose. Like I said, most multivitamins, they are regulated. Is the daily recommended dose that are present in them. So I'll leave it as that. I hope that helps. Thank you.
Thank you so much. Thank you so much, Professor Joyce-Simi. It's been an insightful
Lovely, thank you.
You know me, I'm for applause. That wasn't for him. Let's do it better. We can do better. Keep clapping, let's hear applause. Thank you very much. Thank
Lovely,
you.
thank you, thank you.
We appreciate you, sir. We appreciate you. So while we're rounding off on that, we are supposed to have a tea break. Before the tea break, we would like to ask you one or two questions. Just, you know how we do it. Just to be sure that you've been attentive. So who best to do that than Margaret? Yes.
Anyway, my father is a professor, so yes, I think I'm the right person for that. Okay. So, question.
I know you were writing stuff down, so consult on your paper.
Should I make it easy? I should make it hard.
Let's start with the hard.
Okay, so fibroids. What is the key thing that Prof said you should worry about, if at all, you should worry about fibroids?
You said the key thing. So you started with heavy bleeding. Yeah, when there's heavy bleeding, and then you also went further to talk about weight, when there's weight gain. Then you also went further to talk. You said key factor, but the key is the heavy bleeding. When your menses becomes abnormal, it's not supposed to be excessively, heavy. So that's it.
A round of applause for her.
Okay, my last question will be, what are the three things? He mentioned three things when he was talking about, taking care of your health. Quality associations, choosing your doctors, and dash. That's what I'm looking for. Yes.
She's looking for something as usual.
No. In the earlier, before.
Nutritional lifestyle. Is that what you're looking for?
No.
Looks like we are going to have a two-time winner.
Well, have you been here before? Go on.
It's yoga.
Group advocacy.
Somebody almost said that.
Because with that, you will get the best. So round of applause for me. Okay.
Thank you very, very much. Thank you. So, at some point, we're going to go for a short tea break. We'd like to let you know that we have nurses in-house. A round of applause for them. They are watching the people that are clapping for them. So, if you don't clap very well for them, when you come there, they'll make sure the thing pokes you very well. You know the way nurses are. That was on a lighter note. Okay, so we have nurses in the building. We have Nurse Sarah, Nurse Juliet, and Nurse Obi. A round of applause for them. Please give a wave. Yes, so we have nurses in the house. Imagine. I just didn't want to bust their bubble. It was okay. When they were raising up their hands, I wanted to say, nurses, but I said no. And just keep quiet. So when we ask you to go for the tea break, once you step out, the first door to your left, that takes you into the nurses station. You will have the opportunity to have your vitals taken, and then they can do a bit of counseling, depending on what you feel or what you would like to know. So, but before we do that, I would want us to go into the next session. It is an interview session, and it's with our special guest. She's in the building, so we're just going to give her, say, 1 or 2 minutes. And before that, I'm going to get her now to come in. Before that, I would like us to stand up. Please, let's stand up. We've been sitting down for how many hours now? Let's stand up. The first thing is, please move. To your left, to your right, to your left, to your right. Your arms stretched out.
Are you sure we'll not do dancing competition like this?
I'm an advocate of moving, sedentary lifestyle is not it. And then, trust me, it helps. Don't you feel better? Okay. I don't want to do the one that we do in class, so let me just leave it. We'll do that later. So next thing is, I would like you to meet somebody, not the person you came with, and not the person you met in the morning. So please meet 4 people. 4 people, please. 4.
Please, I want to meet you.
You need
if
to
you
know
have-
their names, their first names, second names, their family name, their family history, who invited them here,
What contract they can give you.
what's their best food, what are they wearing? You know the way they do it. What are they wearing? Okay. Thank you. Thank you. Thank you. Did I see someone yawning just now? I caught you. Thank you. Thank you. Thank you. Let's go back to our seats. Let's go back to our seats. I would like some VIPs to please come to the front. If you know you're a VIP, please come and sit in the front.
Please, let's move forward, ladies and gentlemen.
If you're on the last row, let's put it that way. If you're on the last row, please come to the front. Yes, Nancy, please come here. Come to here. Come to. Thank you. I'm not giving you the mic. Just come and sit in front. Don't worry. Please. A round of applause for her. She's coming forward. And uncle, yes, please, you too, please come to the front. Please come for them. It's you, sir. You, sir. Yes, sir. Yes, sir. Please come here, sir. Should we bring those ushers to come and get you? No, you are not okay. We are not okay with you. Please don't come forward.
Come to
Both
the
of you are
honorary
invited.
seat in front. Sir.
Please clap for them. It's not easy to come to the front.
Yes, we love you for supporting women and our cause. Please come forward. Please clap for him, clap for him, clap for him.
Thank you. Thank you very much. Okay. So we already have our special guest in the building. Thank you very much, Mr. DJ. Please clap for the DJ. We are not clapping nicely. So how many people got like 4 people before I call our special guest? How many people got like 4 people? If you know you met 4 people, please tell me their names and what they're wearing.
So in front of me I have Juliet. I wouldn't even forget because that's my mother's name. Sorry, Ngozi, sorry, I forgot. And behind me I have Olamide. Okay, and then Adedoyin and Egwola. Oh, she doesn't count. Okay, that's fine. And I Tammy, the camera guy.
Please give her a resounding applause. That's a good one. See, now when she gets home now, she's going to think, I met 4 people. You know, somebody was telling me yesterday, they said, women they are special people. You know, there's the way their brains are wired. Their brains have the capacity to manage the past, the present, and the future. You know, their brains are like some complex machine. You know, they're better than men. Did I say that? No. Scratch that. When it comes to the brain, anyway, that's what the person was trying to tell me. And it was a guy. The guy said their brains are like sophisticated machines. They can retain information, you know, things that happened in the 70s, they can be telling you today. And that's why you see when they are talking to you, they can bring the past to the present and they can just jam it with the future. And you'll be wondering, please come for women now. So you see, when she gets home now, she's lying down, she can think back on all the people that she met today. You can imagine that places we go to, you just sit down in one spot, leave from that one spot. And when you ask yourself, who have you met? Nobody. So meeting someone is actually something. So the next stage will be you now take their phone number, you get it, and their complimentary cards. Thank you. So without wasting much more time, I would like to introduce the interviewee for this session. Her name is Pearl Alere. I'm sure you've seen her on the banners, okay? She's a consular officer at the Nigerian Embassy. She loves shopping in her spare time. Who doesn't? She has a degree from Durban University of Tech, South Africa, and an MBA from Monash in South Africa. Ladies and gentlemen, please make welcome Belle Aleri. Keep clapping, keep clapping, keep clapping, keep clapping, keep clapping, keep clapping. Isn't she lovely? How do they say it? She's demure.
She's very demure.
Her steez is intact. No, please don't blush, don't blush, don't blush. You got ready for today, and we should appreciate it. Please, once more, let's encourage her. And to anchor this session, I'll be inviting the founder of Endo Survivors International, none other than Olivia Mwagudu. A round of applause for Olivia. Keep clapping, keep clapping. Okay, so, ladies and gentlemen, I present to you the interviewee and interviewer.
Thank you very
Yeah,
much.
but I think we need to just run her bio briefly before they start. So let's tell you a bit more about Ms. Pearl. So she's a resilient endometriosis, adenomyosis, uterine fibroids, and asthma warrior. Round of applause for her, please. It's not easy. Ms. Pearl was diagnosed with endometriosis in 2016, adenomyosis, and uterine fibroids in 2018. Resected and lost valuable time to these conditions. Every day is a new challenge living with debilitating illnesses, but she has remained hopeful. She's an advocate for early diagnosis and awareness. Her mission is to empower others through her journey to take control of their health, be their biggest advocates, and never give up. It's mind over matter. This year's Gynaecological Summit aims to empower women with knowledge about their bodies, reproductive health, and available health solutions. Pearl will be in the room, and together we will empower, educate, and advocate and develop thriving systems. Thank you so very much, ma'am.
Good afternoon, everyone. Thank you all for being here, and I must commend my friend Lady O for organizing this event. Thank you. Hi, Phil. I hope you're not nervous. Oh, you are. Don't worry. Just look at me and focus. Let's just gist. So today we'll be talking about Pearl's journey with endometriosis, adenomyosis, and everything she's been through. And I want to thank you again publicly for sharing your story. We've known each other for quite a while now. By the way, I'm the founder of Endo Survivors. Endo Survivors is an NGO in Nigeria, one of the few NGOs focused on doing anything about endometriosis. So we focus on endometriosis, education, awareness, research, advocacy, and patient support. So in my line of duty, raising awareness, that's how I got to know Pearl. So, and I'm really grateful for the opportunity to be interviewing you. And I'm sure that by the end of today, a lot of people will have learned a lot, and they will be better. You'll be inspired, because disease is something that we don't get to talk so much about in this part of the world, especially diseases that deal with women. And diseases like endometriosis that cause so much pain, there's very hardly any awareness about it. And once there's no awareness about something, there's always stigma attached to it. But Pearl is so generous and gracious to share her story, and we'll just love to hear from you. So can you just tell us how you got diagnosed with endometriosis? Can we start from there?
diagnosed
So,
and when?
I got diagnosed with endometriosis in 2016, adenomyosis in 2018, uterine fibroids in 2018, and I was born asthmatic. I've always had pain as far back as when I was a teenager, and when I hit puberty, that's when the pain became unbearable. For some reason, the adults in my life at the time didn't take my pain seriously. Not so much because they didn't understand it. I also didn't understand what was going on. But I remember one time my mom had taken me to go see a doctor, and he usually made light of the situation and said, if you can't handle period pain, how can you handle childbirth? So in my naive mind, I thought that there was nothing wrong with me. It was normal to have such pains, and I lived my life like that up until 2016 when I got my diagnosis. And I thought, for once, someone took me seriously. Somebody understood that there was really something wrong with me, and I had my first surgery. I thought having this surgery was going to change my life and I was going to go back to my normal life, but it turned my life upside down. And since 2016, I've had 19 surgeries since then. The last one was in the end of 2022, where I had a full hysterectomy. So in the course of all the surgeries I've had, I've lost my ovaries, my fallopian tube, my rectum was resected, my vagina was resected, my bowel was resected, my uterus is also gone. I always tell people, I know when you look at me, I look nothing like what I'm speaking about. It's because I've always looked at myself as a warrior. I refuse to allow my situation determine the way that I want to live my life.
Amazing. Wow. Thank you so much for that. So can we just take it step by step, just for the purpose of any young girl here, or I'm sure there are doctors, nurses here who see patients. What was your first presentation of endometriosis? So you had pain. You said you had pain as a young girl. Nobody took you seriously. A doctor actually told you, if you cannot handle this, you cannot handle childbirth. Yeah. So what were you thinking at that time? And I would like to know, at what point did you feel like, no, this is not normal anymore? There has to be more to it.
I think
How old were you? Sorry.
I think at the time when when the doctor dismissed me, I was 21. At 21, that's when I first saw a doctor and I was dismissed.
Wow.
Yeah. And I would say, to be honest, it's been physically challenging. It's one of those things where you try to find some kind of balance on how you want to survive and how you want to live your life. It's not the easiest way to live. Something as basic as you have a lot of pain. I struggle to eat. Things as basic as just going to the bathroom to poo, going to the bathroom to pee, passing gas, eating. Those are things that trigger the pain. And over the years, I have. Find some kind of balance. And like I said before, I'm the type of person that, regardless of what is happening in my life, regardless of what's going on with the condition, I try to make the best out of it, because I don't want to look at myself as somebody that has lost it. I don't want to see myself as somebody that has given up, regardless of what is going on. I always try to push, and it's not easy, don't get me wrong. I have moments where I break, I have moments where I cry, I have moments where I feel like it's the end of the world, but then again I tell myself I don't want to dwell in these moments for too long. So I cry, and I dust myself, and I pick myself up, and I keep it moving.
Amazing. Please, a round of applause for Pearl. So you had menstrual pain, you had abdominal pain, you had bloating, the leg pain, you said nausea. You said you found it hard to eat.
Yes.
So this loss of appetite, all these were the symptoms you were having before you got diagnosed.
Yes.
So after you got diagnosed, before you had the surgery, what was the treatment plan? Were you on pain meds? Were you on hormonal treatment? Can you take us through the
So are
journey.
you asking before my first surgery?
Yes,
or
before
after
your
my
first surgery.
So before my first surgery, actually, I had no medication. I had nothing.
Okay.
So I would just suck it up. I don't know how I was able to get through those days without pain meds. I would just leave my life literally with the pain. When that time comes, I would just deal with it as it comes. It affected my working. It affected my schooling. There are times where, when it's that time of the month, it gets so bad to the point where I could bleed on for 3 weeks straight, and then I end up becoming anemic, and I need blood transfusion. So I wasn't really taking anything before the surgery, other than the times when I would have blackouts and then I would just get admitted. They would give me something for that, and that was it. But in terms of the pain, I just lived with the pain like that.
Wow. Wow, wow, wow. So you had this pain and they didn't even put you on analgesics or anything, and they just gave you. So did you do a scan, ultrasound, MRI, anything? So what was the diagnosis? What were you doing
So at
surgery
the
for?
time, so this was before the surgery or after the surgery?
Before, I mean, let's take the fact you've done 19 surgery. So I'm just curious to know how you got that endometriosis diagnosis the first time,
So
and then how
there was a day that the pain became unbearable, and my friends were like, "This is not normal." And that's when I went in and I got a professional opinion. And when the lady saw me, she literally just looked at me and she said, when I explained my symptoms to her, she said, "There's a possibility you might have endometriosis." And then when we did the scan, that's when they found that I do have stage 4 endometriosis. And then she referred me to a specialist that I had my first surgery with, and I carried on.
Okay, so how was the first surgery, and what did they do for you?
So in the beginning, to be honest with you, I was very naive. I had no clue as to what to expect. Even if the doctor had said that endometriosis has no cure, in my naive mind, I just believed that my story was going to be different. We're going to have this surgery, I would go in and they would take whatever it is out and I would move on with my life. But that's not what happened. So I went in for the surgery and I had complications. I was taken back in the second time on the same day, and the surgery was meant to last for 5 hours. It ended up lasting for 9 hours. And when I woke up, the doctors just looked at me and he said, "Whatever God I serve, I should keep serving that God, because he doesn't know how I was able to survive with that much damage inside of me." So during my first surgery, I lost my left ovaries, my fallopian
That
tube.
first one.
That's the first one.
Wow.
My rectum was resected, my vagina was resected, my ball was resected, and that's how it played out.
Okay,
Yeah.
thank you so much. So I just want the audience to know, for those who do not know, that endometriosis is a disease. I think Professor Rotimi said it already. There's a delay to diagnosis, because a lot of times young girls who are having severe menstrual pain, they don't even seek treatment, just like you. I'm surprised. Even at 21, you hadn't even seen a gynecologist at all.
I think it's because I was dismissed the first time, so I just assumed that it was normal,
Okay.
but deep down I knew that there was something wrong.
Wow.
And I think also another issue that I did have, and I blame myself for that, because I was already dealing with one health issue. I was born asthmatic. I just thought to myself, like, I don't want them to tell me that there's something else going on, and then I have to deal with all of these things. And so I also ignored it. I could have asked for help sooner, but I didn't. I just thought, it comes, it goes, it comes, it goes. At some point, it's probably just going to go away. But that's not what happened.
So how old were you when you had this surgery where your rectum was resected?
I was, this was in 2016.
Okay.
So I was 32.
Jesus, 11 years.
Yeah.
Wow, wow, wow.
Yeah.
11 years till you got this surgery
Yeah.
where your entire organ, your vagina was resected, your rectum was resected,
Yeah.
your ovaries were removed, the two of them at
No,
31.
I had for the first surgery, everything on this side was taken out. So my left ovary, my fallopian tube was taken out, and I was left with the right one to give me the ability to have my own child.
Child,
Yes.
okay.
So that's what happened the first time. And then, of course, as time played out, things didn't turn out the way that I expected it. Some people would ask me, "Why did you keep having all these surgeries? Why didn't you just, have a hysterectomy in the first surgery and just get it over and done with?" I don't have my own child, and so I wanted to give myself the ability to birth my own child. And
so sorry to hear that. So, how have you coped? How have you coped with all of this? Like, at the time you were getting this full hysterectomy 2 years ago, what was your mindset? How did you feel about it? Had you given up? You know, because you had been trying to save your uterus by having these surgeries. You've been having conservative surgeries because you were hoping that you would have a child. So how did you then feel when you had to make that decision to give up your reproductive?
I would say that that is the toughest thing I've ever had to do in my life. Even up until this day, as I speak to you, I still don't agree with it. But I know that it's something that had to be done to preserve my life. Unfortunately, I'm human, and unfortunately, we live in a society where there's an expectation on you as a woman. There's this thing where, oh, why aren't you married, or why don't you have kids, you know? So I wanted to be that person that I wanted my own. So when this came up, it was a big debate with my doctors and I. We went back and forth for a long time, and you know, eventually I had no choice. I had to let it go. I was not okay with it. I still am not okay with it, because they prepare you for everything that's going to happen before the surgery and what to expect, but nobody prepares you for that sense of loss that happens afterwards. I had my hysterectomy the end of 2022. 2023, which was last year, was my toughest year yet. You know, I started having triggers. For instance, I would see a random baby on social media, and that was a trigger for me. I would see a pregnant woman. I had a friend that was pregnant, and she wouldn't want to tell me because she was worried as to how it would make me feel. You know, these were triggers I never had before. But the moment I had a hysterectomy, it changed the ball game. Last year, I thought I was going to die. I was so sure that I was going to die last year. And I'm saying this because I want people to understand what the grace of God can do and how the grace of God can change things in your life. I was so sure that I was going to die last year because I looked at myself. I've had all these surgeries. From the time I got diagnosed, I said to myself, okay, we found out there's a problem now, we're going to fix it. But that's not what happened. It wasn't fixed, and I've had all these multiple surgeries. I've lost the majority of my organs. A lot of my organs have been resected. And the reason why we started these surgeries in the first place was to give me the ability to have my own child. And then now I've gotten to this point where I'm being told that that's not even an option. Like, what else is left for me? Like, and to make it even worse, after doing that, having the hysterectomy, it didn't stop the pain. So that's also even made me more angry. You know, I've put my body through so much, and I'm still not getting the result that I want. So for me, I was done. I literally was done last year. It was so bad that I made contact with a funeral parlor to plan my funeral. Wow. I was so sure that I was going to die. I was so sure. But then my therapist advised me and said, why don't you go home, go be around family, and see if you're going to get something out of that. I came back home, I went to go spend some time with my parents, but I didn't really get what I wanted out of it. And then when I came back in January, I was scheduled for another surgery, and my doctor had said, let's just do a scan and see what's going on. And then he said to me, the scan that we had a few months before I went home, and what he was looking at, you could see that there was a bit of change. And that was the hope that I needed, that pushed me to say, let's keep fighting.
A bit of change with what?
So the areas where I had my endometriosis, where I had the lesions, it looked like it was smaller, it was bigger before, then it looked like it was smaller. I don't know what happened, I can't explain it. He also cannot explain it. But that glimmer of hope that was given to me with that appointment at the beginning of this year was what changed everything for me.
Amazing. A round of applause for her, please. Wow. Thank you. That's so inspiring. I know members of the audience are itching to ask questions. I'll come to you, but I just want her to, share the very important aspects. So I'm so sorry once again to hear about everything you've gone through. So how did you come out? You said last year was very low for you. Between then and now, you look so radiant, so beautiful. You're radiating energy. So what happened?
To be honest with you, I think I have a very strong spirit. Sometimes I call it a stubborn spirit, but in a good way. I'm the type of person that I refuse. I refuse to be controlled by what is going on in my life. A lot of people, when you look at me like with everything you're saying, I look good and all of that. My life is like a movie. You don't get to see behind the scenes. You only get to see the final product when I look like this.
Tweet that out. Somebody should tweet that out. My life is like a movie. Please write it down for me. again. You don't see what happens behind the scenes,
No, you
right?
don't get to
They
see.
don't see you,
You don't-
coming. They don't
you
know what
don't-
you're coming out
No,
with.
you don't see me when I'm not able to eat, the sleepless nights, me popping pills to keep up with the pain, the leg pain. Sometimes I'm not able to walk properly, I'm crippled. Some people ask me, you're wearing heels, but you're in pain. I always carry a big bag. My flat shoes are not far away from me. I'm the kind of person that I like to dress up. So everybody, I look at individuals, we all have that thing that ticks us, that makes us happy. Dressing up makes me happy. So regardless of what endometriosis has done to me and every other condition that I'm dealing with, I refuse for it to take this away. So I find ways around it. So I'm still going to wear my heels, but I'll put my flat shoes in my bag. If the heels get uncomfortable, then I take it off and wear my flat shoes. But I will not allow this to be in charge. No, I will not allow that. No.
So what support did you get from your place of work? Can you tell us about support systems? Because Professor Rotimi talked about that in his presentation.
Yeah.
He talked about advocacy, he talked about support groups, he talked about family, the kind of things parents share with their children.
Yeah.
So do you want to talk about areas, the things other people did or didn't do that wasn't or made you better or made you feel better or worse?
To be honest, this is a journey that you need all the support that you can get. But then not every support is helpful support. That's what I also say. Because some people will think they want to help you, but their help is not good enough. And that, I don't mean that in a bad way.
Just give us an example. I understand what you're saying.
You know, I don't mean that in a bad way. For example, I have a friend, I used to have this friend of mine that every time I would want to go in for surgery, you know, she would want to be there and support and all of that, which was nice of her.
I told them, I don't know, guys still using. That guy asked me, guy is waiting for you for not such a guy can you doesn't have to wait. So I said that.
Okay, we are paid before coming down here.
Exactly now. No, you only agree with them now. See, that's it.
So in terms of support, so this friend of mine, she would always be there, but then it almost felt like I became this burden, or it felt like she always wanted to, why are you always having surgeries all the time? Like, isn't it enough? Like, why are you always, so it almost feels like I became a burden to her. And such a person, it's not my fault. I have no control over what's happening to my body. And if the doctors say I need surgery, I need surgery. So it's either you're there to support me as a friend or leave me alone. So such people, I appreciate them. I tell them thank you and I just walk away.
So as a survivor, talking to other people here, how do you think a patient should be supported? How would you have preferred her?
I think the people that your support structure should be people that are very empathic, people that understand that you're going through something that is not your fault, people that want to educate themselves, enlighten themselves about what you're going through, understand what endometriosis is and what it does to your body, and people that just genuinely want to just be there to support you, not necessarily to give me your 2 cents or your opinion, just to listen sometimes, because sometimes I don't even need you to advise me and tell me, oh no, you can adopt, you can do this, you can, because I know all that. Sometimes I just need somewhere to offload and just let everything out. So people that get it, people that understand, those are the kind of people you should have in your circle.
So a listening ear,
yes,
an empathic friend, someone who you can just cry on. You don't need judgment.
Yes.
You don't need advice.
Yes.
That's
Just
very
listen.
important.
Just listen. Yeah.
Thank you so much. A round of applause again for Pearl. So, what about your place of work? What kind of support would you have expected? Did you get any, or were there deterring factors to you?
To be honest, I think I'm one of the lucky few when it comes to my place of work. My bosses have been exceptional, but that's not been the case for other endo warriors. I know about in our support group, a lot of them have lost their jobs. Some had to quit. Some got fired because they felt that they were dropping the ball. But my bosses have been very, very accommodating. They do understand that I have a problem. Of course, you have maybe 1 or 2 colleagues that try to be funny, and those ones, they don't really matter, so I just ignore them. The people that matter have always shown me support, and I appreciate that.
Amazing.
Yeah.
Congratulations on that, really, because it's not really very common, actually.
No, it's not. It's not. That's why I said I'm the lucky few that when it comes to work, my bosses are very understanding. They've never made me feel like I'm a burden. I would say maybe the only thing I would struggle with sometimes, I feel like when I'm okay, I always feel the need to overly compensate, to close those gaps that I wasn't there. I'm constantly like, is there anything you need me to do and stuff like that. But in general, they have been amazing. I've never had issues with work when it came to my health challenges.
What about financially?
Financially, of course, health we all know is very expensive. It's not something that it's cheap. I do have my medical insurance, and unfortunately, when I work, I'm not working to, when you start your life as a young person, you have a goal, like, okay, I'm going to work this year and I want to buy a house, or I want to buy a car, or whatever it is that you so desire. But for me,
you're saving to pay medical bills.
Exactly. You know what I mean? You're working and you're paying off medical bills, and that's been my situation. I've been lucky enough and blessed enough to have parents and my uncle that have been very supportive when it comes to that as well. Sometimes when the bill gets overly crazy, they come in and they're like, no, we're going to be there, and they would do that for me, and I'm very thankful for that.
Amazing. I just want to mention, Pearl, if you don't mind, Pearl lives in South Africa. She doesn't live in Nigeria. So I know there are people who feel there are things we go through that only happen here in Nigeria. It will amaze you to find out that in South Africa, you pay out of pocket too.
Yeah, you do.
For a lot.
Yeah, you do.
You know, because a lot of people would condemn Nigeria and say, we always pay out of pocket, we don't have health insurance. It's true. Our system is not perfect.
Yeah.
But in South Africa, she had 19 surgeries for endometriosis, and it did not go.
Yeah.
But you hear some people lambasting our doctors and telling them, oh, I've done surgery today, it hasn't gone. I've done another one, it hasn't gone. Yeah. It's true that, with endometriosis, we keep advocating for capacity building.
Yeah.
Not just endometriosis anyway, a lot of these chronic diseases and gynecological things. We keep advocating for our doctors to get better.
Yeah.
But the lack of skill and expertise is not just
up to standard.
here.
I agree.
It's in South Africa as well. Did you have any surgery in Nigeria at all?
No.
All of them in South Africa, and the doctors still couldn't even figure out what was going on. So. Yeah.
And these were experts. Like,
I know.
Their specialty is endometriosis, adenomyosis, and the likes. Like that's their specialty. But unfortunately, they were not able to give me the help that I needed. And I remember one of the doctors had said, maybe if I had come in, maybe during my teenage years, it wouldn't have gotten as bad as it did. But unfortunately, I got to them at a very late stage, and so whatever they were doing for me was just to preserve as much as they could, because the damage was already done.
Do you want to talk about the surgical skills? Because here in Nigeria, we keep talking about excision for endometriosis, complete removal of the adhesions, as opposed to, burning up the tissue.
So with there are two types of two surgeries, two ways to take out endometriosis. There's the excision and the what's the other one called again? Ablation. So now, excision is the best because it takes everything from the grassroots. With the ablation, you only burn it and it comes back again. Yeah. But the excision, there is no guarantee. There is no guarantee that it wouldn't come back again. But it's the best bet that you have compared to doing an ablation.
Okay, so do you want to talk about any lifestyle modifications you've done for endometriosis and for your health generally? Are you the type, you have diets, you have exercise, you have all those drinking tea, ginger, and all those things?
To be honest with you, I did that in the beginning because for 3 years, healthy stuff, salads, greens and all of that, it got me nowhere. So I'm like, I want to enjoy my life. I try as much as I can to eat healthy, but for the most part, I just eat what my stomach allows me to eat.
Yes, you mentioned that. So how about now, you looking at the future, looking at the fact that you've attained a certain level of wellness and some stability in your health, do you think you should incorporate any lifestyle modifications like exercise, diet, and all of those things?
To be honest, I think to each their own, whatever works for you. Because today I could tell you that I'm going to start going to the gym, and then a week later I don't feel like doing that anymore. So whatever works for you, it's not one, it doesn't, my methods of taking care of myself doesn't necessarily mean it's the best way to go, or it works for the next person. Whatever makes you feel comfortable, if you think you want to start a diet, try it out and see how it makes you feel, and then you go with it. For me, I just live my life as I go. I'm not, because I think for the last 5-6 years, especially dealing with endometriosis and all of these things, I have done everything by the book, and it's gotten me nowhere. And in that space of time, I've lost so much time of my life. so much has happened, everybody else has moved on, and I'm still stuck with endometriosis. So for me, I just want to live life. I take it as every day as it comes. If today maybe I have a salad and tomorrow I decide I want to have a steak, then so be it.
Yeah, when you're talking about the time you've lost, I mean, I was just calculating between age 21 and now, that's like 17 years with endometriosis. Someone that was born, someone that was born when you got diagnosed with writing WAEC or something now. That's a long time to deal with a disease. And, it's not peculiar to you. I'm sure you know that. As much as your story is so inspiring, sadly, and I'm so sad to say that, that's like, is a reflection of the lives of many other women that are living with endometriosis. They live with endometriosis, adenomyosis. Some of them come up with cancer scares as well. And the sad thing is, of course, infertility, and then the sad thing is, some may not even have access to health care or to, the financial independence that they require to live this life. But do you have any advice to women who may be going through the same thing? Is there any word of encouragement you have for them?
I think the biggest thing is your mental health when you're dealing with something like this. And I will say this again, unfortunately, we live in a society where people are very judgmental. So you need to protect your mental well-being at all costs, because the moment your mental health is affected, everything else is a flop. The moment your head is not in the right space, everything is a flop. So for me, I always tell women, surround yourself with people that understand what you're going through. Protect your mental health. It doesn't matter, like the way I live my life right now, I don't care who you are. If your energy affects what I have going on, because I have been through so much, if your energy affects my well-being, I cut you off. I cut you off. I've been through a lot already in my life. I don't need to deal with any kind of negativity. I don't know how much more time I have on this earth, and you think I would spend that trying to, on things that don't make sense, if you get what I mean. So for me, protect your mental health at all costs. You come first. Your mental health, your person, if anything makes you uncomfortable, if it's something that will make you stress, because stress is one of the things that triggers the pain.
Yes.
Anything that will put you in a situation that you would be in pain, that you would feel and other people will not feel, you cut them off. Cut them off. Cut them off.
Yeah. So, what's the place of faith for you? I know you're a Christian.
Yeah.
So, can you just share with us if there is any place for your faith, spirituality in this journey you've been through in your health?
There's no way I would have been here if God wasn't in the mix of all of this. There's no way.
Hallelujah.
There's no way.
Hooray.
There's no way. There's absolutely no way, that I would have been able to get through all of the things that I've been through to be able to be here. There's no way. I always tell people, when all of this started, I was one of those people, I just lived a very carefree life, but soon enough I realized that I needed God on my side, and I needed to put him at the center of everything, and that's exactly what I did. There's no way, if God was not in the mix, I would have survived 19 times. There's no way.
Yeah, that's true, but there's a flip side. Some people say, oh, I've been through so much, I stopped praying, I cannot pray anymore because I've been praying and nothing has changed. So what do you say to such a person?
But that's what like I said to you earlier, one thing you must understand, I'm not always this confident, I'm not always this strong. I'm human. You're allowed to break. You're allowed to have those vulnerable moments. The only thing that's wrong with that is when you dwell on that vulnerability. Then you bring in negative energy, you bring in the devil. The devil is sitting there looking at you like, I got you. No, you cry, you sweat it out. Whatever it is that makes you want to scream, if you have someone to punch, maybe you want to punch somebody, I don't know. Whatever it is to get that, but just don't allow yourself dwell in that vulnerable space, because the moment you allow yourself to dwell on that, it's over. It's over. And that's why I tell people it's a mind over matter kind of game for me over here. Endometriosis, adenomyosis, uterine fibroids, and Pearl. We meet and greet. After that, I keep it moving, and that's that. That's that. That's that.
You should write a book.
That's that.
Because you're really dropping some hard
No,
lines.
but
Really
it's true.
meet and greet with
We
endometriosis.
meet and greet. We do every now and again, and I talk to it like it's a person. Like this morning when I flew in, the flight took longer than it was supposed to, and I sat down for too long. And sitting down is one of the things that makes the pain uncomfortable. So when I'm like, dude, be very careful, like not now, like relax, chill. Like I talk to it. I pep talk myself. I'm like, that's the only way you're going to get through things. Because if every time it hits you, this thing is, until God says it's enough, you have to find a way to go around it. Until then, you need to survive. Until then, you want to have some kind of normalcy in your life. Like you still want to function. So regardless of what it does, for me, I pep talk it. Like, for instance, I remember the other time a friend of mine was asking me, like, how do you feel about this whole thing? Now you've had a hysterectomy, you're not going to be able to have a child. How do you feel about that? And I'm like, every day is different for me. There are days I wake up and I'm like, I'm fine with it. And there are other days I don't feel so good. But then I always tell myself, on those days when I don't feel so good, or when you have society try to tell you, what are you waiting for? Why don't you have kids yet? I hold my hands and I tell myself, if it's God's will for my life that I be a mom, surrogacy, adoption, whatever inventions tomorrow they have out there, somebody's going to call me mom one day. But if it's not God's will for my life that I be a mom, that's okay. That's okay. Look, as women, we're already dealing with a lot. Life is already complicated. Now imagine being a chronically ill and trying to navigate this life that's complicated and then have society put the expectations on you as a woman. Are you trying to kill me? So if it's God's will that day somebody's going to call me mom, great. But if that's not what he wants, it's okay. It's okay. We're already dealing with it enough. I remember in 2020, COVID happened. That year of 2020, I had surgery in March. 2 days after the surgery, I got discharged from hospital because COVID came into South Africa and the doctors were worried. I went home with tubes hanging down my stomach, a catheter hanging down my vagina, and I was sent home. I was left alone. The country was in lockdown. I was left alone with my thoughts. A few weeks after that, that was the same year I was busy with my MBA program. My supervisor calls me and says, we're moving all the classes online. And I was like, okay, how am I going to do this? I'm like, let me try and fail. Then I know that I tried and I couldn't do it. I did it in that state and I finished. Wow. So why are you judging me because I don't have a kid? Because I'm not married or I don't have a kid, then you want to judge me with that lens. Why don't you look at every other aspect of my life? If I pack up my stuff today and I move back home and just be a couch potato, nobody can fault me for that. But I work a 9 to 5. I have a business that I run on the side. I'm still trying to be a productive member of society. And here you are judging me that I don't have a kid. Or because I'm You focus on yourself. You focus on what makes you happy. Surround yourself with the people that understand what you're going through. And everything else is noise.
I'm so inspired. I'm so inspired. So you were doing an MBA with your work, with your business, with the health.
And it wasn't easy, don't get me wrong, I say this again.
It's not easy for healthy people.
You will not survive a day in your shoes. What we deal with as women, even if you don't even have put this thing together as good as I've done, then maybe I'll listen to you.
Wow, amazing. A round of applause, please, for Pam. Wow, that's really inspiring.
Thank you.
Can we open to the members of the audience who have questions?
I'm sorry I'm backing you guys. I'm a little bit nervous. That's why I'm doing that.
Thank you so much for sharing. Yes.
I love you. Word
resilience.
Thank you.
In a way that a dictionary cannot tell you. I was close to tears and I kept looking at you. I said, her makeup is intact, so what's my own? Because
we're ready to talk, that's why.
yeah, I love you. I know what it takes you to put all of this together. And while your journey might not be the same for everyone who's here or who's watching, we all have similar challenges,
of course,
that are binding, and it's just a cycle of inconveniences.
Yeah.
But you've challenged us today, and I want to say a big, heartfelt thank you to you. One thing I also want to underscore, I made a few notes while you were talking, is you've also made a clear delineation between accepting God's will and resignation. Resignation is that absolute loss of, all right, I'm just going to let it all go and just scatter. Acceptance is understanding, and I just started a video series myself on my page out of some of my stories to say that God cannot mismanage our lives.
True.
He's got
Very
a plan, and if his plan is for you to have pain, my love, you will have pain. Have that pain and be happy while you're at it, because this is life.
Yeah.
There's no take two. There's no act one, scene two.
True.
We're going to
Very
walk.
true.
This is it.
Very true.
This
Very
is
true.
it.
Very
And
true.
there's no practice and then come do the real thing.
I agree.
So
I agree.
I just want to encourage everyone here again. Don't resign and say,
I'm done. Yeah.
it's tempting to be there. In fact, it's easier to be there.
Of course.
Because the pain is heavy.
Of course.
And it's the
Of course.
easier way.
Of course.
But there's a higher level of accepting that the infinite God, that's what I always say. When I love looking at the planets, just reading. And when I lose myself in the thought of the creation of the firmament, no, now God cannot mismanage our lives. Thank you. Thank you very much.
Thank you. Thank you. Sorry, let me just say something quickly with what she said, and I totally agree with what you said. When I went through that moment, I think towards the end of it, I said to myself, why am I always saying why me? Why not me? What makes me any better than the next person? And that's when I needed to find my purpose. And I realized my purpose was taking my attention away from me and making somebody else happy. And that's where I find my happiness. So I agree with you.
Yes, thank you. When she was saying that, I was going to remember, there was a time we talked, and you said the same thing, why not you? And it's amazing how you've been able to, in spite of everything that has happened to you, you still help with the support group. You're still active in the support group. Your story, we played your story at our endometriosis symposium earlier this year, and people were so moved. And I think that says so much about you and, and about so many other people who are using their lives to help other people, turning their pain to purpose. Yes, because rather than just wallow in self-pity, you've now become this embodiment of resilience, strength. Other people can actually point to you and say, if Pearl went through this, I can do it. And to me, that's like the purpose of life, really, helping other people to, find why they are here. So thank you once again.
Thank you.
Hello, everyone. Thank you, Pearl.
Thank you.
I've been blessed, to be honest. And I also want to add, apart from you talking about your issues, the problems and all that, I really think you should be an inspirational speaker, to be honest. Because a lot of people are looking up to you too. You don't know what people go through. Yours is about health. A lot of people go through so many things. And when you talked about mental health, to be honest, that's everything. If you want something to pull you down, it pulls you down. Yeah. Like energy. If you suspect, oh, this person is not good for me, I think we have something in common. And I tell people, maybe because I was brought up in the north, the northern will tell you, back home, no problem. And that goes a long way. Nothing affects me. I go through a lot. Sometimes people tell me, how do you survive? How do you do things? I don't understand you. What kind of a human? My best friend tells me that. Recently, I told her, look, I think I'm giving up. She said, giving up what? One time I had an issue, and I remembered you, Juliet. She had to fly to America to go and get help
because it affected her mentally. But she said by the time she looked at herself and she remembered me, Ju has gone through so much, much more than this. And she's still standing. She even tells, she's the one who encourages people. So why should I let this affect me? So, you know, it goes a long way. To be honest, what you're doing, I think you should really go into this, you know, to be honest, think about it. You know, you should always just wait for when you are invited or when people who know you, you know, because I haven't met you before, this is a great story. You should be out there helping people, to be honest. So I really thank you very much. Your story is so inspiring, so encouraging. We are living here, honestly, packed with a lot of knowledge. Our life is changed. Thank you.
A round of applause for her.
This is quite. Well, for me, this is quite a beautiful experience, and listening to you is all I could see, and all we could all see here is we just see someone who God has wrought a great miracle in your life, and looking back into what people have gone through in life, yours is quite exceptional. And we're on behalf of men, many men, on behalf of fathers and brothers, we love you.
Thank you.
I love you, and there are many men that really celebrate your journey and your experience.
Thank you.
Not all men are critical. Not all men are mean. I have sister, wife who have gone through similar that sometimes I say they should write a story about their life. We celebrate you on behalf of men again and again.
Thank
we
you so much.
love you.
Thank
Thank you
you.
so much for your
Thank
story.
you. Thank you.
And then, like she said, you have to consider, as God will for your life, that you have to bring this to a larger space so that we can understand. We don't know. There's so much ignorance, and then we need to know. If we don't know, there's nothing we can do about it. Until we know, so we can share. Because in every home, in every family, people are going through this.
True.
But your story can turn things around for us, for humanity. Thank you so much.
Thank you.
Thank you very much, sir. Okay, more comments are coming.
I would take the privilege to also stand because I sat right in front of you, and I think firstly I would like to say thank you so much. I feel like hugging you, but you know, thank you. You know, thank you so much. And on behalf of everyone, I'm sure the room was very quiet when you started, you know, your presentation, and what you're doing is you're liberating others. And that liberation is what Africa needs. That's what the world needs. That's what Nigeria, South Africa, and wherever we're present, that's all we need. Because liberation of freedom is what really makes the difference. And thank you so much for sharing your story. I think the organizers of my Gynae issues for bringing you to Nigeria. And I think even just getting you to come here, it's part of the purpose you're fulfilling. And I say this because, you know, sometimes, even as women, we have our own share of the story. And you just have just a clip. And then you're all over, crying, shouting. And I sat here listening to you. And I'm like, what? And this is you, you know, putting in the positive spirit just to encourage every other person listening to us, to you. And thank you so much. And that's all I have to say. Thank you.
Thank you, ma'am.
All right, thank you so much. So from the moment I walked into the room, I noticed you sitting behind, and you know, I just had a glimpse of you. I'm like, oh, she's so beautiful.
Oh my God.
Totally packaged. You know, very demure, very cute. So those around me, they know I actually love to be that way too. So when I saw you, I admired you first. And then when you started speaking, I just fell in love with you.
Thank you.
So for me, I believe that God gives everybody the perfect shoes. He doesn't give you a size bigger or a size smaller.
Yeah.
So there is definitely a purpose for every human on earth.
True.
Nobody was created by mistake.
True.
And there's nothing you go through that is by mistake. True. It was meant to happen for a greater purpose.
True.
And I feel you're right there for a greater purpose, to fill those shoes.
Thank you.
And I feel and I believe that you should embrace it and just continue doing what you're doing.
Thank you.
It could be a side thing, but please don't give up on this.
Thank you.
This right here you're doing, that is what it is.
Thank you.
So please, thank you very much. And I
you so
appreciate
much.
every
Thank
word.
you.
I would
Thank
like your Instagram page also, because I want to make sure that you're doing this. Thank you so much.
Thank you. I appreciate it.
Thank you.
so
And I
much.
think that's something we should take away from here. We shouldn't just come here and leave. Everyone should have everyone's details.
Yeah.
Everyone should go and do something.
Yeah.
And for me, what I'm going to tell you is you need to write a book. You see, you can come here today, go to another place tomorrow, but your book will go all over the world. And it will be saving lives even beyond what you know. So, thank you.
Thank you so much. Thank you. Thank you.
Thank you, Ma.
Thank you.
Yes. So, I wanted to first of all thank you for what you've said. And, you know, as a man, being a young boy, you don't know a lot of stuff until you experience or you see them. So, hearing from you and seeing from your experience, respecting women is the first.
Thank you.
Is the first. And we've been taught by that by my mom. But aside from that, my elder sister, I think she needs to know you. That's one of the things I will say. And I'm going to get your Instagram so I can get to her.
Thank you.
So she has been passing through an experience. She married the wrong partner for 9 years, and she could not give birth. So she was passing through a lot of stuff that we did not understand what she was going through. So, and then she had to leave the home. But I've been the one, so I won't put me as the first, but I've been the one she reaches out to. I'm the second to last.
Yeah.
But she reaches out to me
All the
a
time.
lot. Because I think one of the reasons is because I can easily relate and just listen to her, and be empathetic, just be there for her. But I think you have to be there for her now, because there's things she's going through.
That's okay.
And she's just struggling a lot. She's struggling a lot mentally. But hearing what you've gone through, she has not even gone through anything that she should be there and then think it's over for her. No.
Sorry to cut you. I hear what you're saying, and I just wanted to say something to that. What I've been through and what she's gone through, I don't like to equate or compare pains, because my strength and her strength are two different things.
Yeah.
It took a lot for me to get here. I wasn't like this when I started. I was in her shoes when I first started. So I don't think it's fair to take away from whatever she's feeling or however she's feeling to compare to say, oh no, Pearl is, she's strong and she's this, she's that. No, it's unfair, because you need to, it's a baby step. I didn't get here overnight. It took a process for me to get here. And my advice, I would give you my Instagram handle or my number so I can reach out to her. She mustn't allow anybody make her feel less of a woman because she can't have kids. This is 2024. There's so many ways you can have a baby if that's really what you want. I'll tell you a short story. I had a friend that passed on 2 years ago. Before, when she got married, she was trying to have kids, and unfortunately she couldn't. She got diagnosed with endometriosis, and she had her first surgery. And the doctors advised her to conceive during that period, and she did conceive. She got pregnant, and we were all happy, but she went in to have that baby, and she didn't make it. She lost the baby, she lost her life. Society that was judging her, making her feel less of a woman, they've moved on. She's gone. So you put you first. Childbearing, it's not man-made, it's God. Until you allow yourself understand that, you would cry every day. I've had somebody ask me that, what are you waiting for? Why don't you want to have kids? Or maybe you want to keep your shape. Somebody has said that to me. Somebody has called me a barren bitch. Somebody has called me that. But no, I don't feel bad. That person is sick in the head. You're sick in the head to think it's okay to say something like that to a person. I feel sorry for you more than anything. So she shouldn't allow herself feel like it's not the end of the world. There's so many amazing things she could do with herself. If she gets it right, okay. Everything else will be fine.
Thank you. Thank you, ma'am.
Thank you.
Thank you very much. Any other comment? Okay, Pearl, do you have anything to say? Any closing shot?
Just to say thank you, ladies, and I hear what everybody has said. I appreciate, being here and the support and the love. I do appreciate that. For years, I've been wanting to do something like this, but I didn't have the guts. Because as much as I speak the way I do, I'm not a people's person. I'm always hiding myself. But I promise I will make an effort to put myself out there and stop hiding, because it's high time that I tell my story, and it's high time people get to know that there is a problem, we have a situation, and it needs a solution. And the only way we can achieve that is if we all come together and raise our voices together. Thank you so much. Thank you.
Thank you very much. So before you go to your seat, I'm going to invite the convener. Onyekon, please come forward. A round of applause for her. No, that's not Onyekon slap. Has to be better than that. So I would like for us to take a group photograph. Let's take a group photograph. Them first. Dr. Obina, please join us. Your session is next. Please, Dr. Yes. Okay. Please let everyone join in so that we have a proper photo. Please, if you're outside, kindly come in. And this is not the end. It's not that you take the photo now and you go home. There's more coming. Thank you. So, thank you very much, Pearl. Thank you so much. I pray that the Lord comforts you every day, every moment. And for everyone going through something similar, I pray that God will always be there for you, even when people are not. From everything that we've seen that we don't talk as much. Things are a bit better than they used to be, but we still have a very long way to go. And these are the sort of things that can help us get to where we're going faster. So today, probably you don't have anything you're doing regarding this or your story. Understand that Onyekon started somewhere, and that's why we're all here for her today. You'll be surprised at the number of people or the caliber of
So I'd like us to be seated. And move forward, yes. Prizes for those who are in the first and second row.
at your heart. Please make welcome Dr. Wakaman. A round of applause. Woo! You know what's supposed to follow now? Let's bring back the energy. Are we going to stand up and do my head, my shoulders, you know? So please, let's bring back the energy. Thank you so much. I love that applause. Till he sat down. Thank you. Secondly, but not the least, we have Dr. Olajumoke Oguro. She's an obstetrician and gynecologist by training. She has a passion for reproductive medicine and women's health. She works with the Alpha Assisted Reproduction Clinic, the ARC, Ikoyi. She is an author of 9 Months and Beyond, a book on pregnancy. She also writes on her blog, Fertility Health Facts, where she educates the populace, especially women, regarding their health. She's a member of numerous professional bodies, both in Nigeria and internationally. Ladies and gentlemen, please make welcome Dr. Olajumoke Oguro. Keep clapping, keep clapping. You're welcome, ma'am. Thank you very much. So we're going to give you something like 10 minutes to speak with us on the topic, and then we'll take questions from the audience. Is that okay?
There are plenty things to talk about. So let me start with the breakthroughs, because as I was discussing with the convener yesterday, and we were talking about certain things, and then she was like, oh, do they do that in Nigeria? And I said, yes. So I'll start with that before I forget, in Nigeria presently, we have the technology to preserve fertility, okay? Fertility preservation in terms of preserving your fertility till when you're ready. What we mean by that is that sometimes even when you have children or young adults, okay, they're not ready to conceive yet, but for one reason or the other, they're going to undergo treatment. When there's an illness or you take medications that can affect your fertility. Even women can also use it as a form of an advantage. We don't have control sometimes on when we settle down, all right? And sometimes you don't even have control. You may want to delay settling down for certain reasons, probably to advance in career, to make more money, you understand? I mean, we all have different rights. And so sometimes you just haven't found the right person to start a family with. So rather than wait, because unlike men that keep producing sperms, a woman has all her eggs, and as she gets older, those eggs also get older, such that we have that end of that spectrum when she ends her reproduction, which is menopause. So the ideal time to start looking at that, ladies in their 20s, when they're less than 35, it's very, very important that we know that these options are available. We know that these options are available so that we can avail ourselves. Because sometimes you see people in their meet patients in their 40s saying, doctor, I want to freeze my eggs. And then that is not the best time to freeze your eggs. Okay, so it's very, very important. Also, it's important to note that like anything in medicine, there are advances, okay? Advances even in reproductive medicine. I know that other things like third-party IVF, where we have use of donor eggs, donor sperms, and even surrogates carrying pregnancy. The truth is, because in Nigeria we do not have laws, legislative laws, but these things are happening, and it's also good to avail yourself. Finally, how many minutes? I want to keep the time. 5. I still have time. I did not know. Okay. So, also, I just want to educate people on assisted reproductive technologies, which is IVF. Now, I see that most times couples actually make that mistake that, IVF is like the end of the spectrum. Okay, it's the end of the spectrum. It is when we have tried that I will do IVF. They don't know that sometimes with IVF, there are also limitations. The age at which you do that IVF is very important. So people, they know about IVF and they say, oh, it's not, it's not yet time. I still have time. And at the end of the day, when they now come to do the IVF and we're given other options, they're not happy with those options sometimes because they have that erroneous belief that, when you get there and you say you want to do IVF, everything is automatic. It is not automatic. Okay, so the truth of the matter is that usually when you have a couple, okay, we usually say they have challenges getting pregnant after 1 year of trying, meaning they're having regular intercourse, meaning they are together. And after trying for 1 year, if you don't get pregnant, you seek help. All right. However, if for any reason you have information that, there are certain things maybe in the past that has happened to you that can affect your fertility, you don't wait till 1 year. For instance, your periods are not regular. Maybe you know that you have things like polycystic ovarian syndrome. You don't just fold your legs and say, I just got married. Okay? Other things like for the man, if for instance he's had something we call testicular torsion, where he had excruciating pain, probably he didn't get to the hospital on time and they couldn't redeem the time, then he needs to seek help on time. Not that you wait. Also, when a woman is 35 and above, after 6 months of trying, you need to seek medical help after 6 months because of the age factor. Because sometimes a lot of women don't know these facts. When it comes to fertility, what applies to Mrs. A or couple A may not apply to B, may not apply to C. It is individualized. So you do not use other people's testimonies to judge your own, because you have different causes for the delay, and you have different causes for the delay, and so you must take that into mind. Okay, because I see a lot of times that people make that mistake. Okay, and finally, because we just have to talk about fibroids, I'm sure my colleague will say more about it. Fibroid is not a death sentence. Fibroid does not mean it is surgery all the time. That is what you must know. Fibroid is not a death sentence. It doesn't mean surgery all the time. There are a lot of other treatments for fibroids right now. Sometimes it's expectant treatments. We just watch and find out the growth if it's not causing any symptoms. It may just be like you went for a scan somewhere and they said you had fibroids, small, tiny. It doesn't mean. Because I've seen sometimes young ladies get into the trap. They say they have fibroids and they now go the other way, unorthodox way, and start inserting all sorts that can also cause issues for them, and they didn't even need to do anything about the fibroid. So it's very, very important that you know that fibroids is not a death sentence. It doesn't mean that you have to go under the knife. In fact, right now you have medical treatment. So the treatment of the fibroids right now depends on whether you are having symptoms, whether you have completed your family. Okay, those are the things that guide us. Sometimes we don't even do anything. We just allow you to, especially when you are close to menopause, allow things to fizzle out, because we know fibroids shrink after menopause. It may not disappear, but they do shrink after menopause. Finally, another thing I want to talk about is endometriosis. Is it time yet? Okay, okay. So endometriosis, initially when we're in medical school, they will tell you that endometriosis is commoner in the whites than in the blacks, but maybe we were not looking for it. Right now, we are making more diagnoses of endometriosis, and endometriosis can really be challenging. We actually have different types, different grades, and endometriosis is also one of the causes of, because of all the things associated with endometriosis, it may be difficult for the woman to get pregnant. So when you have a diagnosis of endometriosis, it's good for you to, and probably you know before, it's good for you to be more proactive if you're trying to get pregnant. And finally, sorry, I will talk about polycystic ovarian syndrome, PCOS. People call it PCOS. I just want to say that PCOS has a lot of long-term complications. Most of the time, gynecologists get to see people with polycystic ovarian syndrome, and most people just think it ends with having a baby. My periods are not regular. If they give you Clomid, you are blessed, you get pregnant. That is it. But it's also associated with other things like risk of hypertension, risk of diabetes, risk of having what we call endometrial hyperplasia, that is the womb thickening very much, and sometimes it also predisposes you to risk of ovarian cancer, that's cancer of the womb. Why I'm saying that is that, so when a lady knows she is polycystic, she has polycystic ovarian syndrome, apart from the fact that you go to the doctors or your periods are regularized, it is important that you have a total lifestyle change in order to prevent as much as you can complications associated with polycystic ovarian syndrome. Thank you. I'll end there.
With these few words of hers, we hope she has been able to convince. Please clap. Thank you, Dr. Oguro. Okay, Dr. Nwokoma, your time starts now, sir.
Okay. In her mother's womb, a girl child will produce the maximum number of eggs she will have in her lifetime. She will produce about 1 million egg cells in her mother's womb. She completes that production at about 16 weeks in her mother's womb. From then till the day she enters menopause, she loses eggs. Production does not occur anymore. She starts to lose. The greatest loss will occur in her mother's womb before she is born. On the day she's born with about half the number of egg cells she produced in her mother's womb. She loses about 1/3 of that before she starts her reproductive life. And then she will continue to lose until the day she enters menopause. Now remember that menopause is a retrospective diagnosis. That means that it is a year after you have stopped your periods that you are told that last year you entered menopause. Not that on the day you entered menopause or on the day you said your period stopped, that you have entered menopause. So the reproductive life of a girl, lady, woman is a bit complex. It is not like that young man who produces sperm cells every day and has to be shedding them from time to time to create space for more. Because of that, one of the reasons why we have a specialty dedicated to women, and I keep saying that if women knew the advantages they had and tapped into those advantages, we will have less problems. There are more girls' schools than boys' schools. For every federal government college, in every state, there is a federal government girls' college. But how many of us take advantage of those facts? They just remain facts, and we keep clamoring for government to do more when we have not even done the basic things that we ought to do. saw Lady Pearl snapping pictures, and I admired her. And I was saying, that's a hot babe. Unfortunately, I came here with my sister-in-law, so I couldn't voice before they report me. Until I heard her story, I couldn't have imagined what she had gone through. But let me start. I've not started though. Let me start my own talk by correcting some things that I heard earlier. The backbone of a lot of things that occur to us is genetic. A lot of things can be traced back to genetics. The fact that some men are unable to produce sperm cells is related to an azoospermia zone in their sperm, in their Y chromosome. And such men, it has been said, when they get to a certain age, will stop producing sperm cells. Some men have this zone in their Y chromosome. Why am I mentioning this? There was a question that was asked that Prof answered. And I just want to add to what Prof said in his answer. A lady had had 3 fibroid surgeries, and she was asking what she should do next and what type of diet she should abide by. So I want to say this. If your womb produced fibroids, as long as that womb is in your body, it retains the capacity, the genetic capacity to produce fibroids. That womb, left on its own, as long as it has estrogen stimulating it, will still produce fibroids. Or rather, retains the right to produce fibroids genetically. So you don't cure the problem by doing fibroid surgery. Did you get that? Dr. Jumoke just said a few minutes ago that it's not every fibroid that requires attention, and that's the honest truth. Some of them we will see when we are operating for twin pregnancy. That woman carried twin pregnancy and was going to deliver successfully until we said no, we are going to deliver it by CS. And then we saw the fibroids by chance. Most of the time, you will see them as chance findings. You will see them at routine investigations. You will see them at autopsy. They didn't do anything to that woman. It's only in about 15% of cases that fibroids will constitute a problem. So the question that was asked, I think one of the panel and one of the moderators, she said, what are the key symptoms of fibroids or something like that? Somebody said bleeding and they gave her a prize. Please collect the prize back. That answer is wrong. Key thing to know about fibroids. And the person said, Prof said bleeding, and they gave the person a prize. And I wrote it down. No, that's wrong. The key thing to know is what your body is now without having any problems. What is your normal health state? So your normal health state at the moment may be that you have one fibroid nodule, which is 1 centimeter in size. Know that. So that when things change, we can know what has changed. So if you are told that you have a fibroid nodule that is 1 centimeter big, in that 1 centimeter in diameter, and is located in the fundus, what they will usually tell you is go to your gynecologist and have follow-up visits with your gynecologist. And then your gynecologist might tell you after 1 year, go and do another scan. And you do another scan, and they say you have 1 centimeter diameter fibroid in the fundus. And after another year, you have 1 centimeter fibroid in the fundus. What is that fibroid doing? It's just decoration. It's not doing anything. But when they say that 1 centimeter fibroid nodule in the fundus is causing you A, B, C, D, you are not having symptoms, then we know that something has changed. We can address that change, because it is not every fibroid that deserves to go under the knife. It's not every fibroid that deserves to be treated even. So we need to know what our baseline health status is before we start prosecuting pathology. I hope that is clear. The next thing I wanted to address is endometriosis. And again, I will say genetics plays an important role. Why do I say so? Now imagine this. In the body, there are some cells that are called natural killer cells. What those natural killer cells do is that they are like the police of the body. Okay, they're not even like police, they're like ICE. You know what they call ICE in America? Immigration, whatever, enforcement, whatever. There are people that go and catch immigrants and deport them. That's what these natural killer cells are. So what happens is this. The human body will have cells that are regenerated on a regular basis. Almost every cell has the capacity to be regenerated. Many cells die and new cells take their place, and the dead cells are eliminated. The cells that cover organs or line organs, they have that capacity more than cells that are enclosed. So for instance, the brain has less capacity to regenerate because it is kind of like in an enclosed space. Meanwhile, your skin sheds cells on a daily basis. Have you understood that? Okay. So your vagina, for instance, is lined with what we call a lining. And that lining sheds cells on a regular basis. So every day if you have a discharge and we take a swab from that discharge, we'll see what we call epithelial cells. They will describe that they have some epithelial cells. I mean, that's not the proper name, but that's what the lab will describe the cells as. The topmost layer of that lining is shed on a regular basis, on a daily basis. If you go to Coca-Cola factory, every factory, everything that produces things en masse, on a mass scale, on a rapid scale, there will always be errors. So you will see bottles that are overfilled, you will see bottles that are half filled. Those are errors. And then you have people whose job it is to remove those. Those are your natural killer cells in your body. They remove those things that were not properly done, so that your body can continue to function normally. That's what normally happens. There must be a problem if the natural killer cells are unable to remove those things. That's how we believe cancer and tumors occur. Because the body should identify those things that are not meant to be part of it and remove them. But once the body is not doing that, that means there's a problem, first, with the immune system, which must be traceable to the genetics of that person. So I'm saying all this because I'm talking about endometriosis. Why should the lining of the endometrium, the lining of the womb, be found in a place that is different from the endometrium? So we have theories for that. And one part of those theories is a genetic theory. There's a theory that says that it is transplanted from that place where it's meant to be to another place. So generally, we have a problem genetically. And that problem is what allows that lining to thrive, not just to exist. Because to exist somewhere is different from thriving. Thriving means that every time you're on your period, that thing also is on its period. Why should it do that? That's an abnormal behavior. You shouldn't do that. If it was there and it was just dormant, yes, we understand, but it is being influenced by the hormones which normally influence it when it is in the right place. So there's a problem. And it's not as if it is cancerous, although it can become, but it's not as if it is ab initio cancerous. So there is a genetic component to this, such that when you have even removed the organ carrying it, like you heard from Lady Pearl, you still sometimes have problems with the endo. So I just wanted us to be clear about some of these things. And now the question is, like Prof was saying, when we understand where the problem is coming from, we can try to see how we administer treatment for it. There was a time we were talking many years ago when I was a resident about immunotherapy for endometriosis. I think maybe in the next few years, people will start talking about it again, because it's seeming to make a lot more sense nowadays when you think about it. And then Lady Pearl again was talking, sorry I'm quoting you a lot, but you're fine, babe. So you deserve to be quoted, about excision and ablation as treatments for endometriosis. And just to add to what she said, the choice between excision and ablation usually will depend on the experience of the operator. It's not an exact science, and the capacity for that lesion to be excised or ablated, because it's not everything that can be excised, and you cannot ablate everything. There's some structures, unfortunately, in the human body. There's no vacuum. There's no space. And you have to create your own space. And if that space cannot be created, then it is going to be very difficult to say you're going to burn something when it is in close proximity with a vital organ. When you burn it, this person is going to start pooing from so, or the urine is going to start leaking into somewhere that you don't want, and all that kind of rubbish. So you have to be careful what you are doing exactly. Sometimes you open somebody with endometriosis, or you try to scope somebody with endometriosis. That has happened to me. You're trying to scope, keyhole surgery, and you can't even enter. You can't even enter. You just withdraw your things, close up, and wake the patient up. Because we have a maxim in medicine. Above all, don't do any harm. The last thing before I hand over my mic, from here I'm going for a condolence visit. Yes. Why are you laughing now? You're laughing at my classmate that died. Can you imagine this, baby? I'm going for a condolence visit. My classmate died 2 days ago. And I was called when they had been resuscitating him, and resuscitation efforts failed. And I went in and I saw my classmate in the theater, because the hospital where he died is just opposite mine. I just walked across the street and saw him lying on the theater table, and he told me they hadn't even started the surgery when he died. And listen, there's a reason I'm bringing this up. And when you come, Lady O, there's Lady P there, there's Lady O. Lady O knows why I'm going to say this, and I'm going to say it with all seriousness, so that maybe we can wake up a bit. He hadn't started the surgery when Boyga died. Okay? I hope I don't get emotional. But he hadn't started the surgery when Boyga died. Boyga, for more than 15 years, he actually told me 20, had been carrying a goiter. By the time he came to see me and told me that he was going to remove it, his neck was massive. They hadn't started the surgery when Boyga died. Because when they knocked him out, when they gave him the drugs for him to sleep so that they could intubate him, the mass that was in his neck collapsed onto the green pipe and blocked it. so they couldn't intubate him. Do you understand what intubation is? To pass the pipe through which he will breathe. When that happened, they took a decision quickly. I looked at the operating table and I looked at the nurses' table, and the scalpel, that's the knife that we use, was not mounted on a backpacker handle. Backpacker handle is what we use to mount it so that we don't cut ourselves when we're using it. It wasn't mounted. They took that blade without mounting it to cut through the mass so that they can find a way to pass a pipe into his lungs to ventilate him. Before they did that, he was dead. Why am I saying this? I've had in the past few weeks women who come with pregnancies of 8 months. So imagine this. They are with pregnancies of 8 months, but they are not pregnant. They are carrying fibroids. Okay, they are 8 months pregnant. That's the way they look, but there's fibroids. And my question is always, why did you leave it this late? And you want me, and what they want to contract me to do is to remove fibroids, and I'll look at them. And I will tell you beforehand, you're going to consent that I'll remove this womb. You're going to consent because I cannot go and say I'm going to remove fibroids, which is a very bloody surgery, and then run to a danger of what happened to Boyega, that I will lose you on the table. If it's getting difficult, I'm going to remove this womb. It is important as women, it's important as human beings, that we address health issues when they arise. Okay? When they arise. Don't say you're waiting for A, B, C, D. Dr. Jumoke has told you that you can preserve your fertility different ways, and they are available. It's just money. It's just what? Money. And money is a commodity that you shouldn't use for ashwebi or your car. No, because if they tell you how much this costs, you won't want to pay it. But when they bring the latest Lexus, whatever, you want to buy. When they want to bring the latest ashwebi that Miriam Babangida, or what, she's dead now, but whoever is doing party for her daughter, you want to buy that. You want to go with the Joneses. Yet, that which is important to you, which is your health, you will sacrifice it on the altar of what? I don't understand. I don't understand. When health issues arise, we address them. You don't wait until you are pregnant and people are asking you, like somebody said, I can't remember who said that, when are you going to born? That is when you now start looking for who to salvage the uterus for you and help you to preserve it so that you can reproduce. Health issues, again, I would say, should be addressed when they arise. Last thing, please forgive me, because we talked about PCOS. Let me say a bit about PCOS. It's becoming more common nowadays, or rather, in my small hospital, I'm diagnosing it more often nowadays. I don't know why. But PCOS is a metabolic disease. I always tell people this. It is a metabolic disease. This is more a metabolic disease than yes. It's more a metabolic disease than anything. I will tell you, it is the junior brother of diabetes mellitus. You will handle it the same way. So I never start PCOS treatment with clomiphene citrate, clomid like that. I never will start you on that. I will tell you what. Oh, sorry. I will tell you what. Go and lose weight. That's how I will start. Go and lose weight. And I will set a target. And I'll tell you by the end of the year, you'll come back to this clinic and we'll weigh you. And I will tell you this is the way we're going to lose that weight. You will start exercising. You're going to force your body to use glucose. Because at the core of this disease is your body's inability to metabolize glucose properly. And it is affecting your ovaries. So we're going to get your body to metabolize glucose. You're going to exercise. You're going to exercise like this every day. You're going to go on a diet. We're going to shed weight. Once we do that, you will find that your periods are likely going to return. So, just to say that, because I know that there'll be plenty of questions. Everybody has been quiet and listening to me and target and looking at me funny, and they want to attack me. I told somebody that wanted to interview me one day, close your ears. You don't even need to hear this one before they report me. You're going to interview me. I say, how many are you? He say, well, 3 ladies. I say, I can handle 3 ladies. It's 4 that I haven't tried. So, I dropped mic.
A big round of applause. A big round of applause for Dr. Wokoma. No, we can do better. And then for Dr. Oguro. Thank you very much. Thank you, doctors. Thank you. I feel that,
I just bought my glasses. Okay, so Dr. Jumoke was talking about regular intercourse for women who want to get pregnant and all, for a couple, when they've been living together for 1 year or 6 months, depending on the age of the woman. I think we're too spiritual in this country. Tokwe and I were talking about this particular thing some days. Thank you. God bless you. We're too religious in this country. Religion is not bad, actually, but the way we interpret it is it's not even to the extreme. It's just foolishness. It's just foolishness that is worrying us, I think. So somebody is married and they want to conceive, and they are having sex with their husband maybe once a week because they devote the other time to going to church and praying and fasting and all those kind of nonsense. We are talking about people fasting for 100 days because they are looking for the fruit of the womb. And she said, sleep with your husband! There are 2 immaculate conceptions recorded in the Bible. Just 2. We all know Jesus Christ, Abi? We don't talk about John the Baptizer. But he was also an immaculate conception. Those are the 2. And they were both meant to do the same mission. The 2 of them, one was to be the forerunner of the other. The 2 of them immaculately conceived. But if you don't believe it, how do you think Zachariah slept with Elizabeth? Sorry. Do you think Zachariah slept with Elizabeth? Do you know he was in the temple when he was told that his wife was going to be pregnant? When? When he completed his mission. Go and read it very well. 2 conceptions. And Zachariah, by the way, was in andropause, by the way. And Elizabeth was in menopause, by the way. By the way. 2 immaculate conceptions. Yeah, okay. Oh, yeah, we had Abraham. We had Abraham, exactly. But 2 immaculate conceptions. Okay, 3 when we had Abraham. So my point is this. That business stopped a long time ago. Every other one, you would work for it. You work for it either on your knees, in bed, on your back, in bed, or with your legs up, in bed. Different positions, if you Google Kama Sutra, in bed. That's how you do it. You don't do it on your knees in church, on your back in church, on your tummy in church. All those things must be in bed. There must be a man there. The man is not your pastor. There must be a man there. And she said regular. Do you know what we define as regular? Ma? Once a day is okay. But at least you must have 2 in a week. At least. And it must be what? Unprotected. Prof was talking about protection. Me, I'm saying unprotected. You are protected if you don't want to have STIs. If you want to have a baby, no protection must exist. That's when you can say that you are trying. Because you see people, I had a consultation the other day and I said, how many times do you people have intercourse? And he said, once in 2 weeks. I said, you haven't started, you don't have a problem. You don't have a problem. You first have to have the intercourse. There must be sperm cells at the fallopian tubes on the day ovulation occurs. There must be sperm cells. If there are no sperm cells in the fallopian tube on the day ovulation occurs, you can't get pregnant. And that is the truth. I'm not talking about a day or 2 or 3 before ovulation. On the day ovulation occurs, sperm cells must be in the fallopian tubes. Sperm cells don't live for more than 5 days. That's the ones that will live longer. But nowadays, the ones that they produce, all these millennials and all, they don't produce the long-lasting one. Their own is produced in China. So they will last 1 or 2 days. There must be sperm cells in the fallopian tubes on the day of ovulation. Shikena, if there are no sperm cells in the fallopian tubes on the day of ovulation, nothing is going to happen. So I just want to make that clear before we start asking questions. Thank you very much.
Please, let's clap again. Let's clap, let's clap, let's clap. How many of you would like Dr. Nwokonwa to be your doctor? You know, there's a mixture of fun with everything you're talking about, as serious as those things are. And I tell you, there's no way you will forget everything that you have spoken about. We won't forget. So once again, let's appreciate him. And our own Dr. Olajumoke Ogunro. A round of applause for her too. The floor is open. You know the thing about this Dr. Nwokoma, I had to put away my timer. Because when he had spent, I think, 6 minutes or so, no, 4 minutes, told me, I'm just laying the background, the foundation. I've not started. So I had to just throw the thing away. So the floor is open. We want to hear your questions and then be able to respond. So who wants to go first? Who would like to bail the cat? We've heard so much. A round of applause for Lady P.
Hello, Doctor. I would like to ask one question. I think I've asked this question several times, but I've never really gotten a response that I was satisfied with. And you did mention something that has to do with the genes and endometriosis. I did read up something a while ago, and I saw a little bit of research that was done in the US about endometriosis and a link to asthma. And I have both. Do you think that there's any credibility to that, or it's just one of these myths that people just come up with?
So let me go this way. If you give me enough motivation to create a link between endometriosis and asthma, I will create it. That's the truth. Is there an actual link between endometriosis and asthma? I can't say. But you said something. You said, I was listening to you very carefully when you were talking. I mean, everybody told you. She loved you. I remember, and I said, oh, the two of them, oh, wow. Sight for sore eyes. Okay, so you said something. You said what I went through. You said where you are is like where his sister, where you were, is like where his sister is. And not everyone is equipped to handle what you are handling, but somebody else told you, I can't see her right now, that the size you're carrying, or she, I think she was the one that said so, is exactly your size, or something like that. So I was paying attention, you know, paying attention. I always pay attention. So my point is this, that the combination of diseases that people tend to have is often unique to them. In that person, when we make that association between those diseases that that person has, but it may not be valid, that combination may not be valid for another person. That doesn't mean that asthma and endometriosis are linked in any way. It doesn't mean they are not. But we may not find that link in a different person. We may find that link even in a number of people, but it doesn't mean that that link is automatic or causal. It may be casual. Okay? So if it's causal, that means that there is something causing that link to exist. But if it's casual, that means that it is just by chance that that link exists. So sometimes we don't clearly delineate between those two things, that some things are casual and some things are causal, or, you know, like I was saying, a causal.
All right, so you must also know that when you, especially with Google now, you read all sorts, okay? So I may do my own research, okay? And this is what I find. And I may say there is a link with endometriosis and asthma. But you see, this is not evidence-based. So in medicine, we also look at a cohort of a lot of studies before we now say we're going to accept this and take it as the link. Now with endometriosis, what has also been associated with is the fact that you may have immunological issues, all right? A third of people with endometriosis sometimes have antithyroid antibodies as well. So you may have high natural killer cells. And so when, in terms of reproduction and everything, you may need some form of immunomodulation therapy to bring down those natural killer cells. Okay, but right now nothing has been, yes, it's not, there's no strong link. So people may have one or two researches, it doesn't mean that it's, yeah. Okay.
I hope that is satisfied, because you are not satisfied.
Thank you very much. Anybody else?
Thank you very much for your time, and thank you for your session. So my question is, using myself as an example, I've had fibroid for as long as I can remember. I think 18 or something. It's been there. And the doctors, they, you know, like, oh, it's fine, you know. And then when I got married, it's never disturbed me, so I've never had to look at it. But when I got pregnant, things were well. And at 5 months, I started having this severe pain. And I started having contractions at 5 months. I said, baby wants to come out. I said, it's 5 months. And then they said it's caused by my fiber, something about degenerative fiber, something. But then my question is, the pain was severe, I was having contraction, but the only thing the doctor gave me was paracetamol. And they said I should pray that the pain stops. So my parents and everybody started fasting. And this is 5 months, which means I still have 4 months to go. And I'm like, I can't do this. I can't take this pain. It's either I go and, you know, take the baby out. I can't die. You're not going to admit me and just be giving me paracetamol every 3 hours. Like it's like you're not giving me any solution. You're just basically saying, go home, your pain, manage it. So I feel like in some way medicine didn't provide enough support for what was going on at the time. Because I cannot be in pain and be pregnant and be having contraction. And then you ask me to go and, you know, open, pray, and, you know, do all sorts of things. Well, eventually the pain stopped, I think after like a month, which if I was working at the time would have affected my work, would have affected, obviously affected me because I was in bed I couldn't move, the only thing I had was pain and paracetamol. Even for normal, I'm tired daily activities, it doesn't work. So my question is, what exactly can we do? Because I didn't even want to get pregnant again. I didn't want, I was just like, let me just leave the fibroid there. It's not giving me pain right now, but when I get pregnant, the pain is, I can't describe it. It's crazy. So by some miracle, the pain stopped. But then I'm imagining that for some people, the pain doesn't actually stop, that they actually have to go through that for the next 4 months, which is misery. I'm not sure I could do it, but I guess that's why the pain stopped, because God was seeing that this girl, she's going to kill this baby, because I was giving up. But so that's my question. What exactly is science doing to make our lives as women better? Because for that 1 month, it was hell. And thank you.
Sorry, before you, so I want to piggyback off of her question to say, what can patients do to advocate for themselves better? Because in her own situation, she just felt like they didn't help her. So what can a patient do to say, okay, you know what, I'm seeing this doctor, he's telling me take paracetamol and go and sleep. But what else could she have done to get a better, outcome?
Okay, let me start with that second question. Get a second opinion. I think we have a poor culture of seeking a second opinion in this country. And I think we should do that more often. We should seek a second opinion. And oftentimes when folks come to me seeking a second opinion, I'll give them my opinion and I'll tell them to go back to their doctors. That way I try to encourage people to have confidence in their doctors. Just, you're coming to me for a second opinion, I render the second opinion, go back to your doctor. It's not as if I don't like money or because my hospital is private exclusively. It's not as if I don't like money or anything like that. But go back to your doctor because he started something with you and you people had a rapport. I don't want to come in and, take over something that I didn't work for, so to say. So I'm starting with that second question. Now, the original question, let me first say that pregnancy is not a disease. Pregnancy is a normal physiological condition that every woman should go through without sacrificing her limb, without sacrificing her dignity, without sacrificing anything. And it's unfortunate, I'm very sorry that you went through this. It's unfortunate that that was the kind of care you got, because there were things available that you could have benefited from, and not just paracetamol every 3 hours. And I think paracetamol every 3 hours, actually, she will correct me, is not the best thing for yourself, your baby, and your liver. That would not have been the best thing. Every 3 hours paracetamol just sounds like, how did they do that? I can't give a pregnant woman paracetamol for more than 3 days. Every 6 hours, not to talk about every 3 hours paracetamol. Good. Okay, so what could have been done? Red degeneration of fibroids is a very common thing during pregnancy. It's not an unusual thing. It's very common. There's a mechanism for that. I won't get into the mechanism that causes it, but there is a pattern by which that occurs. You can have either red or white degeneration of fibroids in pregnancy. All sorts of degenerations can occur in fibroids at any time. But the most common one in pregnancy is the red degeneration, which you had. Two things that should be done at such times. We should hydrate you properly, and we should give you adequate pain relief. Those are the two things. And paracetamol will not have been the adequate pain relief for you at that time. There are opioids that are given without... Okay, I react to opioids. I will tell you anytime, don't give me opioid. Even when I had surgery, I won't take opioid post-op. But that's a very good thing to give to a pregnant woman, because that's the one that will cause the least side effects on the baby. So that's the one you should have been given at that time. But a lot of people, because of fear of addiction, now that's a real thing, will not want to give you opioids because you don't know, it's not written on your forehead, I'll get addicted to opioids. But that's the thing of choice. A short course of an opioid at that time with proper hydration should have gotten you out of that.
at the time when you're having, it's also part of the bed rest, good hydration and analgesia. So it just helps the pain goes off. So you see, the thing about it again, maybe there was just a communication between you and your doctor. When you have fibroids predisposes you to certain things. So in as much as fibroid doesn't cause infertility, but having fibroids, depending on the size and the location of the fibroid, may affect your pregnancy. All right, so sometimes things like degenerative changes, predisposing to preterm contractions, okay, having babies lie abnormally, depending on where the fibroids, increased risk of operative delivery, having excessive bleeding when you deliver. Those are some of the complications. So the most important thing is communicating with your physician and of course having specialist care. So that, because there are certain things, a woman delivers, she has fibroids, you know she's going to bleed more than normal than somebody without fibroids, because the uterus has been working, finally expels the baby and just like relax, so it doesn't contract. And because it's a big surface area, you are more likely to bleed more, even if you have cesarean delivery. So there are steps we take, you know, to ensure that the uterus continues to contract. All right, so fibroids affect pregnancy. So, and that's why when you have medical conditions or other issues associated with pregnancy, specialist care is very important. And apart from that, I also think patients make the mistake. Sometimes doctors talk to you, they think you understand. If you don't understand, tell them you don't understand. A patient now gets up and starts complaining. Remember that sometimes antenatal clinics are very, very busy. You understand? Especially, I don't know if it's a government setting, there are lots of patients, so you may not have that time to really go into details and educate the patients. However, if you just tell your doctor, I don't understand, I want to believe that most doctors will take out that time and let you know. You know, this 21st century, most doctors will do that. Rather than you now, you know, it was needless. It's a common thing that occurs when you have fibroids.
So please, prosecute your second pregnancy. Don't worry. Everything will be fine.
Thank you very much, doctors. We have Professor Gynaecology online. He would like to make some comments as well.
Yes, can you hear me?
Yes, I can hear you. Please confirm you can hear me.
Yes, I can hear you.
Fantastic. You have the floor, sir.
No, I'm off camera, if you don't mind, Doc. Just to say thank you to my colleagues. I have listened attentively. I said I wanted to come on because I was going to make some comments. And let me tell you what, you have made all the comments I was going to make. The red degeneration. A young lady spoke about contractions and pain. There was probably more pain rather than contractions. Yeah, you could have the irritability due to red degeneration. But if there were labor contractions, you wouldn't have carried that pregnancy for another month or months. But the pain you had was due to the red degeneration, and my colleagues have told you exactly what the best treatment is. But perhaps, and again my colleagues have said it, perhaps what that doctor did not do was to communicate that my colleagues have given, and off my heart to both of you, and learning from both of you as well. And going back to the issue of endometriosis, I think most of the diseases that human beings have some genetic underlying to it. But the thing, like we have all said, is the research has not been done. We are getting there. We're doing it. I don't know whether it will surprise us to hear that men can also have endometriosis. But you're going to say, but they don't have a uterus. But I'm going to take us back to the very first beginning, where we all started from. Starting from a cell, one cell that has that potential to differentiate into everything and anything. Hair, thyroid, cartilage, bone, endometrium, myoma, fibroid. So the human body has, when you have dermoid cysts, in a dermoid cyst, you can have hair, you can have cartilage, you can have bone, you can have tooth, you can have fat. So the human body has got that potential just to spontaneously, like my colleague said, immunotherapy, gene therapy, there's an underlying genetic basis to all of these diseases. And it will be good to see us in Nigeria and in Africa undertaking research. If we wait for our Caucasian colleagues to do it, they will not do it. So again, so the fact of endometriosis, it can come back. We don't know why it's got genetic predisposition. There was a time people said, oh, it was because women were wearing corsets. And when you wear that corset, it squeezes blood through your fallopian tubes and into your abdominal pelvis. And I think even corset has come back now. You will see women now wear the incidence and prevalence of endometriosis in Nigeria. But no, doctors, we don't know what causes it, but there is a genetic about Lady P. Thank you for sharing your story. I always say it that patient stories are very powerful. We as doctors, whether we are male or female, we haven't walked in your shoes. And then when we hear patient stories, they are powerful. It's an avenue for change. It hits us that really, is this what this woman has been going through? And that's why I said, when you have all these teenagers complaining for pain, don't just dismiss them. It could be the early onset of endometriosis. So let us listen and investigate as necessary. So thank you once again to both of you on the panel. Like I said, I wish I were with you, and I look forward to meeting you at some point.
Professor Daisy, we appreciate you, sir. Any other question? Anybody from there? Okay.
Thank you. I just wanted to add that sometimes some of the problems that we do go through or we have sometime in the future or in our lives are also constituted by some of the advice we get from the doctors. What I mean by that is you might have an issue and you walk into the hospital, see a doctor, and he tells you, oh, okay, you know what, don't worry about it. Just go and take enough rest or, take some days off, travel or something like that, and you'll be okay. So they are not patient enough to actually listen to you and diagnose exactly what is wrong. They just, because they've had a similar case with a particular patient, they generalize it and just tell you, go and do this. And at the end of the day, being that your doctor has told you, I think it's nothing, just go and, just don't think about it. Just take some rest. Before you know it, that problem compiles. Because you've been to the doctor, you just realize the doctor said it's nothing. So, and then what I'm trying to also, match that with is what the doctor said about seeking a second opinion. Sometimes some of us actually have these doctors or a particular hospital we are used to. You are always going to that hospital, or you always insist that you will see Dr. Afolabi or something like that. If Afolabi is not in, you wouldn't want to see somebody else. And Afolabi is used to seeing you. So sometimes, oh, madam, hi, So sometimes it happened to me. It wasn't a doctor I was particularly, ready to see. But I don't know what happened. They just asked me to go see that doctor. The second time I else, and believe you me, by the time I saw someone else, it was a different thing altogether. I was sent to go run some tests, do some, x-rays and all that. But he never cared. I'm just saying that point you made is very valid. Seeking a second opinion could be a different.
Thank you very much, ma'am. And I have a personal story to buttress that. My mom was sick some months ago. I think I shared with Oyinkon. And, you know, the hospital where we are taking her to, they had said, oh, from everything we were seeing, looks like she has arterial disease because her limbs are swollen like times 2 the normal size. And, you know, they went on to tell her that they're going to do surgery here, surgery there, this one 3.5 million, this one 3.5 million. And then we're going to amputate the legs, 1.5 million here, 1.5. And I'm not joking. I'm not joking. This is a true life story. And then we're like, are you joking? This person you're talking about is just 76. So she has older siblings. She has a 94-year-old, a 92-year-old, an 86-year-old, an 84-year-old. This is the baby of the house. No, we're not, you know, comfortable with that. And then we said, okay. We went to another hospital. They checked, and they put her on some antibiotics, and then the swelling began to reduce. But then it was still dark on the ankles and things like that. Long story short, we went for a third opinion and a fourth opinion. And at the end of the day, what simplified all of this was just to switch her BP medication. I don't want to go into details, but what I'm just trying to buttress is that, you see, we in this part of the world, so I want to use that my mom's story as a case in point. So they said, go and bring 10 million, because that was the total of the money they were asking for. So whether they were trying to use that as a business or what, I don't even know, but this is a very reputable government institution. I just don't want to mention their name. So imagine that we'd stuck to what they had said, would have gone to look for the 10 million, brought the 10 million, and then amputated my mother's legs. For God's sake, when you amputate somebody's legs, how do you even begin to manage that person? That person will die, first of all. And then you, as the child or the family, you'll be traumatized. If she doesn't die, you start managing something that, you know, you shouldn't have. And then probably in future, somebody, because I've gone through a procedure sometime, even outside the country. And what another doctor here in Nigeria told me that thing is just an outpatient procedure. You didn't have to go under the knife or something like that. You know, nobody wants to hear you shouldn't have done that when you have done something that has transformed your life. So you cut somebody's leg and you're not hearing, we would have just changed it up, because I can imagine that after cutting the legs, and that problem probably degenerates into something else, they'll not say, all we needed to do was just switch the medication. And then they'll be telling you this after the person's 2 legs have gone. So if we don't take anything from here, I think whether it's endometriosis, whether it's fibroids, whatever it is, you know, it is just important to seek that subsequent opinion. It is very, very critical. I also would like to prioritize the place of spirituality in all of this. It's important to also pray for direction. It is very, very important. You want to go and see a doctor, you want whatever you choose to do. Follow your instincts. Follow whatever, you know, you pray, you dream, whatever. Let God also guide you, because I think that was what really saved us at the end of the day. We're just going from one place to the other, one place. We ended up at Duchess. And by the time my mother arrived at Duchess, by the time they checked the vascular surgeon and the orthopedic surgeon, you know, those kind of surgeons, all of them say, the leg is actually improving. We've checked, they checked for the veins, the arteries, they said everything is working fantastically. This was the same limbs that some people had said they should cut off. So please, honestly, it's been for us in my own family, it's been traumatizing, you know. We went through a serious trauma from like March to like July or June. So let's just do that second and third. We don't do it here. It's very right to ourselves. We don't. We don't. Once somebody tells you something, and you know the funny thing, we now carry that thing, we live with it, we breathe it. When you even see us, we're looking worse than people that actually have that thing, even when it might be correct or might not be correct. And then, of course, we know for doctors too, in fairness to them, sometimes we don't disclose everything that we're supposed to. Sometimes we don't. So I think that when we also do full disclosure, it gives them the opportunity. Because, like I said earlier this morning, nobody knows your body than you do. So the moment you start noticing small things are wrong, it is better you start doing something about it. Not that, I'm afraid. Because that's another thing here. I'm afraid. I don't know what they will tell me. You could die before the death itself comes. So I'm not a doctor, but please, let's encourage our doctors. Let's really clap for them. Doctor, I'm going to start coming to your hospital.
Okay, let me just say something in response to the last two statements. Then I will really drop my mic after that. Full disclosure was, I think, the last thing I heard. Once upon a time, a lady entered my office with another lady and a man and said, "This is my lesbian lover, this is the husband, the father of the baby." I said, "Welcome, lesbian lover, welcome, father of the baby. Please take your seats." She thought she was going to shock me. Me. Me, shock. Okay. So, what I'm trying to say is that she thought what she was disclosing to me was a problem for me to handle. I have handled more serious issues than that. That's not the kind of thing that will shock me. I would rather you tell me than I assume, and with my assumption make the wrong diagnosis. I always tell my patients, I am a gynecologist. I am not a priest. I am not a pastor. I don't preach morality. I will tell you how things are. The last patient that came to me saying that she wanted fibroids removed, I said, "Madam, under one condition." "Are you married?" "No." I said, "Under one condition." "Are there children here?" "No." I said, "Once I remove it, you're going to start fucking." "Sorry, you're going to start fucking because you must get belly. If I'm removing this fibroid, you must get belly. I don't care whether you're married or not. Because I can't go and suffer." I said, you're going to make me to suffer to remove this fibroid. I can't come and suffer, and then 2 years from now, you will come back and tell me that the fibroids have regrown. I'm not going to hear that. You go and carry belly. So my point is this. I would rather you tell me the truth and let me know where I'm starting than you do magu-magu to the answer. I don't like that. We used to do magu-magu to the answer when we were children, but no longer as adults. We'll tell the truth. It is true that some of us don't listen. I know. Some of us, Jumoke said it, we are busy. If we're, okay, I'm not busy because I'm in private practice, but if I'm in government practice, you have a queue of women waiting in front of your office. You cannot give each person more than 5 minutes. When I give appointments, I try to make sure that everybody's appointment is at least 1 hour. In 1 hour, we can discuss your life history. But my colleagues in general hospitals and teaching hospitals cannot afford that luxury. They won't close. And they have to close. They have to go home. Somebody called me one day and said, "Are you in the hospital?" I said, "Madam, what's the time?" She said, 9 o'clock. I said, "Are you meant to be in the hospital at 9 o'clock? I have a house. Hospital is not my home. I don't live in the hospital. I can't be in the hospital by 9 p.m. Okay? So everybody has to close. Everybody has to go home. The hospital can work 24 hours a day. But it's not the doctor that works 24 hours a day. It's the hospital. So they run shifts. So the doctor that you met in the morning will not be the doctor that you will meet at night. Okay? But because we have limited time, unfortunately, every day has 24 hours. Try as we may, we cannot extend any day beyond 24 hours. So we have to use that time wisely, right? So, because some of our colleagues know that they have to do a certain amount of work within that time, they don't have your time, unfortunately. If we have to visit such hospitals, then we can't go there and be saying, "Ekarasa, Ekarama, and I don't speak Yoruba, but how are your children? How is the family?" You go straight to the point. Tell them their issue. Say what it's worrying you. Let the person know, and let them know what they are going to do about it. We can't be dilly-dallying and wasting time in such settings. You can waste time when you have a lot of time, but when you don't, you have to go straight to the point, talk about what is worrying you, and disclose as much as possible in the time that you are given. Because it is the much that you disclose that will make the doctor know where to touch. Because we first listen to you before we even touch you, and before we tell you to go and do tests. So we will know where to touch when you have told us enough. And then when we have touched, we'll know what to send you to go and do, so that we'll get the amount of information that we need to diagnose your case. And diagnosis is not the whole thing. There is a long way after diagnosis to get the adequate treatment that is tailored to this patient. Not just treatment general, but the one that will work for this patient. And sometimes that will take a lot of patience from both sides. So sorry about your experience, about people not listening to you and drawing conclusions because A worked for, XYZ worked for A and B, and then transferring that to you. Sorry about that, but when such a thing has happened, you don't need to divorce that doctor. Go to another person. Just seek a second opinion. Get that second opinion, compare and contrast. Go home, discuss with the family about it, and then take a decision on what to do. If necessary, get a third opinion. I think opinions, getting information is important. And any of those opinions should not be Google. Dr. Google can never take responsibility for the opinions Dr. Google gives. That's the honest truth. I don't mind you Googling things, but don't depend on Google for your therapy, because Dr. Google will never take responsibility for what he says. But it's me, you can hold me, you can jack me up and say you said this and shake me, if I can shake, and get whatever you want from me. You understand? And make me take responsibility for the things I've done or said. So that's my take on that.
Thank you so much. Thank you. Just a
Thank
comment
you very
from.
much, sir.
Oh, actually, sorry. A comment
Online.
from Professor Jaisimi. It says the panelists are great doctors. Please pass my compliments to them. And I think there's a Chidima online with her hand.
She wants to ask a
raised
question.
up. Yes.
Thank you.
Chidima, please unmute and ask your question.
Can you hear me, please?
Yes, we can.
Okay. So I just want to say thank you to Lady O, Lady P, and all the doctors that have shared light on so many issues today. So I have a question, and I'll quickly go to that. How long should one wait to seek fertility treatment after taking out fibroids?
On the average, that standard one is 6 months. After you've had an open fibroid surgery, that's they cut you open. Six months of recuperating before trying to get pregnant. Okay, that's the standard. However, if for instance age is not on your side, maybe 3 months after you can start trying. But if you're not so old and all, 6 months before you start trying to get pregnant again.
It doesn't mean, Chidima, that if you get pregnant in the month after the surgery, you should go and terminate it. So please carry your pregnancy.
Yes, that's true, because you don't say because the doctor says 6 months. Well, that's the advice, so that your body can get back to normal and the whole place would have healed. That's all.
Thank you, doctors.
Thank you.
So I'm asking this question for a friend that just had a fibroid taken out like a couple of months back. Based on what you said, are you saying that once a fibroid is taken out, it will definitely reoccur again? And then is it very compulsory that the person must get pregnant immediately after the surgery?
Okay, so what I said, and I'll repeat, a womb that has produced fibroids retains the genetic capacity and the genetic right
to produce fibroids. It doesn't mean it will, but it retains the right. So if it has produced fibroids, it can still produce fibroids, even if all the fibroids. Remember what Prof said when he was talking. It's not all of them we will see. Even if we are doing open surgery with a microscope, it's not everything we'll see, because a fibroid, no matter how big it gets, starts from one cell. And then that cell continues to multiply and gets as big as it we eventually see it. So some of them will not be seen. It's not possible to see all of them that the womb has produced or can produce. But that womb has the genetic capacity to produce fibroids. Okay? Are we clear on that? It doesn't mean it will happen, but it has that right. So we'll remove the ones that we see, and then some years down the line, others would have been produced by the same womb. As long as that womb is there, and as long as that womb is stimulated by the female reproductive hormones, it retains the capacity to produce fibroids. Now, the question to your question is, why did we remove the fibroids in the first place? If we remove the fibroids to improve your chances of getting pregnant, why wait? Get belay? Ma? How do I want to take the disturb you? See fine girl, oh. She's single. See fine girl, the talk says she's single. So what? Men don't finish. If the issue, see, I'm not talking, look, I'm writing, she knows, I'm writing something religious right now. I'm writing a religious book, right? But I'm not talking like somebody who even reads the Bible. I'm talking as a scientist, purely as a scientist. If your purpose was to get pregnant, to improve your chances of getting pregnant, that was the purpose of performing the surgery, then why are we talking about, why is that an issue? If we, Lady P said something, society should not judge you based on the fact that you are married or you have children. That's you are the person judging yourself. Okay? We shouldn't be looking at that. If that is your objective, go to Dr. Jumoke's place, buy sperm, get yourself pregnant. If you don't want to do it, then yes. But it's possible. You can do this. She talked about third party. Third party involves purchasing sperm or purchasing eggs. That's what third party is all about. So if you don't have, your egg cells are old, for instance, you can buy eggs and use the eggs with your partner's sperm to carry a pregnancy. It doesn't mean that you will be successful, because at the end of the day, it is God that gives children. So the fact that you have done all that wahala does not mean that you will carry a pregnancy successfully. It doesn't even mean that when they transfer the embryo into you, that it will take. That's what we use, that it will take. No, you can fertilize, but even to put it back, after putting it back, it might not. They will do a pregnancy test 2 weeks later, and it will be negative. Then you see your period. It's possible. It's at the end of the day, it's not you that will govern whether you will be pregnant or not. There is a higher force than you and I. But if you say that your purpose is to conceive, and that's why you removed the fibroids, I don't see why you're delaying. I don't see why there should be a delay. I don't see.
All right. So, well, I totally understand doctor's position. For being female, I have that advantage, being female and being an obstetrician. So it's actually easier said than done. The truth of the matter is that there is emotional part when you're not ready yet.
or you've not found somebody you're ready with. Even the donor sperms, donor eggs, you must have closure. You must be willing to do it. It's not even about society. Sometimes it's about yourself. What I would advise such a person is, one, you can just monitor. Maybe have routine scans to see whether they are growing. The truth is, nobody can predict how fast you have fibroids that will grow back. So just closely monitor and take your decision. But don't, for the fear of fibroids, go and bring a child that you're not ready for. Don't, for the fear of fibroids, end up with somebody you're not happy with just because of fibroids. Amen.
Thank you very much. Thank you very much, doctors. Thank you. Thank you all so much. I mean, this was an amazing panel, amazing session. Thank you very much. And thank you all so much for, staying, till now. It shows that, you really, take your health seriously, or, you take women's health really seriously. Thank you so much. I think my key takeaway today is that, women's health is, something that, healthcare generally should be customized. It shouldn't be a one-size-fits-all approach. I take that away from, from the conversations that we've had. And thank you for Dr. Oguro for sharing that insight, because, we don't expect that, you just go and get pregnant, because after getting pregnant also, you should be able to look after a baby. Thank you. So, again, I'd like to say to our speakers, all our social media handles. It'd be great to have you connect with us. I think we can do another that you can take away on your way out. Thank you very, very, very much. Sorry? Contact details. The doctor's contact details. Yes, you can. Dr. Okoma, you're going to get, and Dr. Oguro as well. There'll be people coming to you. Did anyone do vital signs and, blood pressure and all out there? We have that available as well. Please make sure that you use that opportunity before you leave. Thank you very, very, very much for coming. God bless you. Closing prayer, yes. Who'd like to give us a closing prayer? Thank you.
Let's pray. In Jesus' name, our Lord and our God, we are grateful. We started with one mind, one soul, one spirit. And we have been able to see through this. It is by your grace, and we do not take it for granted. And this is why we have all come back to say thank you. Lord, accept our thanks today in Jesus' name. Holy Spirit, we pray as we go to our various destinations that we will do all that you have assigned us to do in Jesus' name. We will not fall nor slumber in Jesus' name. May the request of our hearts and the meditations of our souls be acceptable unto your sight, O Lord. For in Jesus' most beautiful name we have prayed.
you.